don't know if you have this document with you.
I do.
I want you to read that question so that we proceed. Then we get to know exactly what was asked from you.
Later. Okay. Just a moment.
And clearly, Waziri, I was not wrong when I said your CEOs are not serious. It has come out clearly that even this morning you're not prepared, and you're giving false information, and even your letter that it's signed by you, it has that volunteer staff. So I don't know what would you want us to do, because if it goes back to the members, the questions are very clear and they are there in your letter. So I don't know what you want us to do. I want you to proceed with your comments that you wanted to make. I would even not want you to read this letter because it's from your desk. Just proceed with your questions, with your answers to Honorable Sharon, and then we proceed.
Thank you, Madam Chair. I stand guided on that matter, and the rest subsequently we will try to be very precise. As I mentioned, we have 41 contracted staff and 3 volunteers from our earlier letter. The letter that we amended and brought it to the House today do not include volunteers.
So you're saying in the previous letter we'll get the volunteers?
Correct.
The lady in question that was here, it disturbed me because she said she's been volunteering for many years, and the lady who was acting on that position, she retired. Is it right? I think it's by the name Nora. The CEO on the other end can help you because it's directly from his department. You can give us information about that lady, and don't tell us you want to give us stories. You want to just hear about the lady in question and why is she acting for all those years in your presence.
Okay, thank you, Chair. The lady in question is called Celestine Chebor, and she was, how she came into the department for internship in the last, in that program, opted to stay behind to probably get more experience, get mentored, and mainly because of their being residents of this town. So they stay here, and they, at that time, where the wisdom of the people in the department agreed to continue mentoring them. That is why the name volunteer came in. She worked at the front desk, assisting as a secretary. At that time, the Department of Public Works did not have a secretary. The one that was there before had retired. When we came in 2023, we had a discussion with a CEC member on the reorganization of the department, and we saw it fit because a receptionist or a secretary handles sensitive documents and also does a lot of communications, that we get someone who is within the county. And we got one, Betty Sergon, who is actually a senior administrative officer, to come into the department and to take up that role. So from 2023, we've not been having anyone acting on that position. We have filled it substantively, and that is the position, Chair.
Is the lady still works with your office?
What has happened with Celestine is she went back to school last year, and I had a discussion with her, because part of the work of our department is to mentor and train staff in various fields, especially the technical staff. And she comes to the office once in a while to assist, to get experience. Betty is helping her, especially now that she's also doing exams in secretarial. So that's why we have allowed her to come to the office. but we have not in any way encumbered her to stay with us. She is always at liberty, and any other person who has come in through training, and we have so many attaches chair from our local polytechnics who come when they finish. And since we don't have an internship policy, sometimes some come to us and ask just to, to stay on and get some experience so that they can be competitive when they are job openings. And also we can give them recommendations when they have applied for jobs elsewhere. So I cannot deny that she comes to the office once in a while, but at the moment she's in school here in Kabarnet.
CEO, as the accounting officer, do you see how painful it is in Baringo? How you keep a lady for 4 years? Does she earn anything from that office?
No, we don't have any kitty or any budget to pay.
Members, let me allow you, if you want to ventilate on that issue, I would want members to make their comments so that we proceed to close that matter. And those are the painful moments that Baringo has really inflicted on people knowingly. Like the way you're just talking about that lady very casually, that she just comes in and goes. How do you allow somebody to come to your office, to come at your office when she feel like coming? And she's been there since 2022. Members, proceed.
Chair,
Sorry, Honorable Sharon, proceed.
Chair, I've heard the way the CEO Timothy Kiboen has explained to us, and I think, Chair, that is a really big issue, and I think it's time that we get to have the policy. And also, I'm just wondering, we might need to really look at that thing, because no one is supposed to be on volunteerism for more than 12 months. It doesn't make sense at all. Probably we could just go back and check that particular issue, because he has given a very good explanation. But again, I was wondering, when you are bringing in the lady Betty, you said Betty, you didn't think it was prudent, now that this lady had been volunteering and working with you and with experience, the CEC, don't you think it was prudent for you to have done probably a proposal to the service board to bring the lady on board now that she has been volunteering for a long time, so that she can earn a salary, probably even on contractual terms, now that she's been there for a minute?
Before Waziri proceeds, I want to make sure that members, you don't have any point on that issue, so that when he goes back to answer, we close that matter. Honorable Aengwa.
Thank you, Madam Chair. This issue of volunteers, Madam Chair, is actually, it is a two-way. It's a double-edged sword, Madam Chair. When somebody, because once I had a plan operator on attachment, and then after completing his attachment, he requested to continue getting more experience, Madam Chair. It took long. I think it is something like the way my colleague Honorable Sharon has said, that we really need a policy so that the departments do not look like they are taking advantage over the volunteers, Madam Chair. And at the same time also, we also want the departments to put on a human face, so that actually, at a given time, they should be able to guide, discontinue, or actually pay them even some stipend, Madam Chair. I think it is good that it is high time that we relook onto volunteers, more so, even if they are getting experience, but we should have a time limit. And at the same time also, we should not have others getting in and be paid when the same volunteer is still rendering what? Service. So I think it is cutting across all the departments, Madam Chair. Thank you.
Waziri, proceed.
Thank you, Madam Chair. I really thank the members for the in-depth thoughts about these people. And I want to extend an invite to honorable members that we need to bring our heads together because these are all our people. But Madam Chair has mentioned that we need to have policies so that we see how, when we have these volunteers, can be absorbed into the system. And I really agree that such a policy is long overdue. We initially had volunteers, interns. That is when these volunteers started coming in. And Madam Chair, I would want to make a clear indication that a volunteer is not somebody that we are forcing to come to the office. A volunteer is somebody who is saying, I want to be attached, or can you give me something I do? I get experience as I look forward, probably in the short term or in the long term, I may get an opportunity to work with you or to go somewhere and get employment. Madam Chair, the Honorable Member Sharon mentioned that why bring another person instead of just absorbing that one. I would like to clarify that the lady in question that came from another department. It's not somebody we hired. We made our intents that we are short of staff and a very long list we gave out. We have budget constraints and stuff like that. So when we really requested that we needed support to public works, public works cuts across all the departments. Then we were given, Betty was reassigned duties to public works.
Honorable Sharon has a point of information, but you allow Waziri to finish so that you can bring the information.
So she came in from another department. We've made policies as head of the department. I came in, we've regulated some of the things that were happening. Like the honorable member said, some volunteers come, they want to be plant operators and stuff like that. But we've made it very clear, our policy, our machinery can only be operated by qualified individuals who are either on contract or are fully employed by the county. So we are doing these policies and we are polishing day by day, and we invite such views so that we can help each other and govern this county and help these people in good faith. Thank you.
Honorable Sharon, as you proceed, Waziri, I think this is the department that has really done good on the machinery. They have people who are on contracts. Unlike the other departments who've come here, volunteers do the driving of our machines. Honorable Sharon, proceed. And then after Honorable Sharon, Honorable Sialo, you take up to proceed with your questions and any point. Okay.
Engineer Lekonaya, for someone to work as an engineer, do you require to be a member of a board?
Correct.
Correct?
There are different levels of...
Okay, among the engineers here, do you require to be a member of a board?
Correct, yes.
All right, so now I proceed to ask my question to one that is acting as our county engineer. What did you say your name is?
John Kibor.
John Kibor. Are you a member of the board?
No, I'm not.
Engineer Lekonaya, who appointed him to be our county engineer?
It's not an appointment per se.
Okay.
It is a position because, as I said, and I've mentioned several times, and if you are keen and if you're listening, that I've said.
Lekonaya, I'm very keen and I'm listening. Please don't accuse me of having a deaf ear.
No, I'm not.
So my question is that you've stated that just now,
yes, that
among all of you here, including somebody who is acting as our county engineer, must be a member of the board and is acting in that position. My question to you is that, do you think that is exempted from being a member of that board? That is a yes or no answer.
No.
that is no, is not exempted. So all the BQs, who signs these documents? Who signs them?
Chair, I'll make this clarification so that we are.
No, allow me to lead the questions, kindly, Honorable Lekonaya. And you know I have so much respect for you. I don't want us to. So, who signs the BQs?
Chair, I'd request for your protection.
There is no protection when you're being answered.
Honorable Sharon.
I think this is not cross-examination.
Waziri, don't be mischievous. Just answer questions. You are an engineer, and I want to applaud you. You're up to date on your board, and you're the boss. So please proceed to answer the questions from Honorable Sharon.
We have 7 engineers, all of them diploma holders. We are only 2 registered engineers.
All of them, including the acting
Yes.
county engineer.
Yes. And if my explanation was allowed to go in, I'd probably shed more light.
We'll get there.
We will allow.
The BQs, the chief officer.
Is the chief officer.
Yes.
So who collects the data?
The engineers.
The engineers. Does that include the acting engineer?
Correct.
My question is that, now that he's holding that position, is there any explanation on this planet that can make him act as an engineer without a license? With all the explanation that you want to give, you have 2 degree holders, the members of probably the board, and then the rest of them, they are not qualified. Can that still make him exempted from being a member of a board?
It is not a requirement. The position is holding.
You remember you've just answered 2 minutes ago that.
Can I respond?
2 minutes ago, when you start to justify that, you'll be lying to us and trying to defend yourself on issues that cannot be defended. Issues of qualifications.
The position of an engineer at the level of engineers I have, those who collect data, there's no requirement that they must
Okay, and
be
him,
registered.
as the acting engineer?
There's no requirement that.
There's no requirement.
Yes.
Can you stand by that? Even the EACC when they come here? The EACC when they come here?
Yes.
Can you stand by that?
Okay, I'll stand by that.
Why is it that you're having somebody who is not an engineer, acting engineer? Why do you have somebody who is an acting engineer who is not an engineer per se?
Honorable Sharon, probably maybe we'll ask him what are the qualifications of a county engineer.
Yes.
If it was supposed to be advertised. And on that note, I allow Honorable Sialo to say something about
Thank
it.
you.
Thank you, Madam Chair. I think everything is clear. Probably the reason why the engineer is acting and is not a substantive engineer could be the reason that he's not registered. So I think that one is clear.
Honorable Sialo, you are out of order.
No, let's be.
You are out of
Madam
order,
Chair, you must be
Honorable
objective. You must be objective on what you are-
Honorable Sialo, you are out of order. Honorable Sharon, proceed as we move to Honorable Waziri.
My question is that what are the qualifications of a county engineer?
Point of clarification, Madam Chair. In our onogram, we don't have county engineer. To be clear, is acting as superintendent engineer, county engineer. Number 2, Madam Chair, the thing that is there is that why we have him acting is we do not have a substantive. I'm not sure. I'll allow my chief to clarify. And for continuity, we could not hold the whole. That is not one of the questions that you had sent to us. We need to prepare for
Lekonaya,
that.
let me read to you a qualification of according to what I've gotten and what is right. A county engineer must be a person who holds a degree, a bachelor's degree from a university recognized in Kenya. registration with the Engineers Registration Board of Kenya, ERB, as a professional engineer. Valid annual practicing license, ERB. Corporate membership with the Institution of Engineers, and so on and so forth. That is the qualification. You've stated that we have recently?
Three.
Yeah?
Three.
Three. How long?
Chief to answer that. And FYI, for your information, that the ones, when I checked, I came to office,
Okay.
and all of them are in the process of registration and getting those.
As down the line, you're still in the process of putting them as registered engineers.
In 1 year.
How many
And-
years have you been in office?
Can I
3 years.
can I answer, please?
Yes.
The registration.
Honorable Sharon, let's
Regis-
allow Waziri to give you an illustration of what should be happening on that point of
Okay, 1
county
year.
engineer, so that it's a serious issue, Honorable Sharon, and let's allow him to give us a true picture of that issue. Or I can see your CEO is up, want to say something?
Yes, I'll mention something and then I'll give the CEO to proceed. We recruited 3 engineers and they're in the process of registration. And registration is a personal initiative to be registered as an engineer. And process, I am not so sure if it was by the officials or position she is in. So it's a process and it is personal initiative. But mine, as a policymaker and as head of department, it is just to encourage and tell the staff, take these courses and register as this position and this one. We have only one registered engineer, of whom we recently seconded or requested as she works across the 2 departments, that is public works, roads, urban planning, and urban development.
Okay.
So that is,
probably
that is
the
an
CEO.
that is an engineer now we've put in, and we are putting, these people are just new in the office.
Okay.
And we are putting them through the process.
And
for that office to
Lekonaya.
have been able to operate, we needed somebody who has
Who
been
is
in the
acting.
office to act in a position.
According
that-
to your understanding as a policy maker,
Yes.
somebody who is acting, don't you think he must have and hold a position of a substantive person?
I'll allow my chief to
No,
answer.
just answer. You're the you're the head.
I'll ask my technical team to assist.
The CEO, Kosgei, kindly proceed. And, okay.
Thank you, Chair. I think to just add on what Waziri said, when we came in, we appreciated the shortage on the side of the technical staff across most departments in the county government, which the Department of Roads, we were seriously understaffed. And that time, we are still understaffed. And that time, we really forced, because we had budget constraints, and we employed three engineers, which we employed last year. And when we raised the indents and the advertisements, it is very worrying to know that even those who applied, we could not get a registered engineer. And that is what's happening in the country. And we advertised it widely. So the few we caught them, like Waziri said, it's a personal initiative, but we push them. We tell them kindly, because it is a process. And within the Engineers Board of Kenya, there are some requirements that should be met for one to be a registered engineer. And within that pool of engineers, pool of the technical people within our department, we were short of graduate engineers. And we had to take personal initiative as the senior team here to even invite to assist the board to make white public so they can apply for these positions. So you also understand what the department had undergone in the past 2 years, what we had. It is as a result of those gaps, staffing gaps, and the technical shortfalls. But for the last 2 years, we have improved.
Through the chair.
We are in the process.
Through the chair, can I
Allow him to finish.
Let me just finish.
I feel like we are not going direct to the issue.
Let me go direct now.
Direct
These
to the
3
issue.
engineers, they have been in probation.
How long?
They are waiting for confirmation letters from the board so that we can engage them. We can seriously engage them substantively in our
As per now,
departments.
the 3 engineers are working as
The
casual workers, contracted,
I wanted to say
the PNP.
they are staff under probation, and they are waiting for confirmation letters to permanent and pensionable terms. And our staff establishment.
Kindly, Honorable Sharon, kindly CEO produce those documents that you're saying they're on probation, and the one for to the service board through your CEC, and so that you're able to know exactly what that means. And the CEC, let me make this an acting engineer should be. So probably Kibori is acting because he's been there at the department, and probably do you do as per the law?
Chair, allow me to just state something that will guide us and take
Okay,
us
Honorable
somewhere.
Sharon, and please let's.
And I'm very specific. Kosgei, these people that you're calling, they're what again? Probation employees?
Waziri, you had
When-
your time. It's
when-
time for your CEO.
These are staff of the county government.
They are brought in as,
They are staff of the county government. They are employees of the county government.
yes, they are brought in
They
as,
are in different cadres.
which ones?
And we have assistant engineer.
I'm asking, are they coming as permanent and pensionable?
Yes, after
Exactly.
after a certain period.
So, when we all understand how people come into office. You advertise the job, they came in, right? Maybe as an engineer, and they came in now, they are supposed to go on probation for how many months?
For 6 months.
For 6 months. How long have they been in office right now?
They are past the 6 months.
Past 6 months.
Yes.
What is stopping them from assuming the office of the engineer?
I have written to the board to confirm them.
Okay.
Because they have completed the probation period.
So we are still having letters pending at the Public
We are
Service Board.
waiting for their confirmation letters.
Okay. And what stops somebody who is on probation from taking the position that he or she has been
Chair.
applied to act to take the position? What has stopped that person to take the position, even if the person?
We have this position of county engineer, and from time to time our staff establishments and our structure of the departments. And when we check the latest restructuring of the staff establishment, the position of the county engineer has been abolished, and there is a new structure now that we've revised our staff establishment in the last financial year that guides us. That's why I want to bring these 3 who were employed.
These 2 establishments started which year?
We revise after every 3 years.
So it was revised?
Yes, recently.
Honestly, Chair, you can see where we are. And let me just make my submissions. There's nothing that stops the CEO and even the Public Service Board to have, let's say, that position of the acting engineer. Nothing under the law that can justify, just because make an acting person not to justify non-qualification of that person. Like, for example, the person who is acting as our engineer, just actually qualified for that person to even act is that. Just close that case. We can go around in circles, but will not make him qualified.
Honorable Kakimon, proceed with your questions.
Yeah, thank you, Madam Chair. I think I asked you the first question on the wages of the casuals, that they stayed long time before they are paid, but the department said they are paid, but this committee received complaints that most of those plant operators have not received their salary or their wages for 7 months. Waziri, you are saying you have paid them?
Waziri, proceed.
I indicated that all our payments are up to date. However, I invite the honorable member, if he has any information of wherever he's complaining, to furnish us with that information so that we can follow it up. So, one thing that I'm sure probably you should mention, that those who are recently recruited maybe have not received their pays, but I'm made to understand by the CEO that it is up to date. So
It is up to date.
Yes, it's up to date. If you have information or when these payments are due, for which period, please furnish us with that information so that we can act on it.
Yeah, the second question, you have something to add to CEO?
I wanted to answer.
CEO Kosgei, please proceed.
Okay, I wanted to answer Member Honorable Kakimona that among our list, the 41, there are some staff who were engaged late last year by the board, through the board, especially from Baringo South. And the delay in payment was as a result of the processes of getting them into payroll, which took some time, up to I think 4 months. But as of last week, all their dues had been paid, and unless on somebody who was wrong or missing account number, but all of them have been paid their dues for the last 6 months. Thank you.
So, thank you. I have the second question. We have seen your list of all the contractual employees, especially the operators, plant operator, and the drivers. Are they entitled to lunches, lunch allowances? If yes, how promptly do you pay them?
Waziri.
Once you are on payroll, that is your dues, and lunches and anything else outside that payroll, maybe when you are on DSAs. Thank you.
No, I'm talking of lunch allowances. Are they paid lunch allowances to these plant operators?
No.
Or the drivers?
No.
They are not paid.
It's what you are entitled to, you get through your payslip. They are not entitled to that unless you are on DSA. Thank you, Madam Chair.
CEO.
CEO Kosgei.
Chair, maybe I can add, it is true what Waziri is saying, but you see most of our plant operators, the machines are all over. And the policy of the government is saying, beyond 40 kilometers from your workstation, you should get some DSA or night out allowance. But what happens with our plant operators, when we send an operator, for example, to Barwesa from Gabarnet, it is beyond 40 kilometers, or to Mogotio, Kisanana. What happens is that we've pushed for these allowances for especially plant operators to be in form of extraneous allowance so that they can come with their payslip. But all the efforts that we've pushed for the last 2 years, the SRC are saying it cannot work that way. And what we normally do, we encourage them to settle where the machines and where the work plan falls within a certain period so that we minimize on those. They are really suffering. And we agree to what Kakimon is saying. But it is an SRC and an HR issue. Thank you.
I think as a department, you all know what kind of work these people do. And for them to be effective, you should also design a way of motivating them. Because if you don't give them these lunches or some stupid to motivate them to do the work, they may not work. We are on the ground, Waziri. Most of these plant operators report to job at noon, and they work for 2 hours. So the work that they are is allocated to do, there are complaints that they are not given lunches, they are not given anything. How do they work on those difficult situations if they are not given lunches and allowances at least to make them work? So as a department, you should see what to do with those plant operators and the drivers. So I think I raise my question there, Madam Chair.
Thank you, Honorable Lekakimon. Honorable Sialo, kindly take up a
Yeah, and before I proceed asking my questions, allow me to give an opinion. Formally acting in that position through a formal letter, or it is just verbally. But otherwise, in that,
Honorable Sialo, on that note, they can proceed to give you the answer because it's a valid question. Waziri, please proceed. And because you've opened the same question, Honorable Sialo, it will still generate some questions if we go to that direction. Because Honorable Sharon is still having some burning.
I stand guided.
Yes.
I just wanted
so I
to
want
find
you to
out if-
proceed, Engineer Kibor. Proceed to answer Honorable Sialo that question. I want him to answer. He's an engineer, and remember, he acts as the county engineer. So allow him also to speak.
Yes, I've got a letter.
So your drawings allowances on that capacity, and for how long have you been acting in that capacity?
I've acted since 2023 November.
2023 November. So
Honorable Sialo, he has not answered the question. Does he draw the answer that comes with the kitty of being acting?
No, I don't.
Honorable Sialo, proceed. If you have any other question concerning the same issue, so that
thank you. Maybe to Waziri and the chief officer. I remember we had an employee, an engineer, who worked in the same, I think, capacity for about 13 years. So I want to ask, for how long is he going to be acting in that capacity? And is it allowed by law for someone to act in the same capacity?
Madam Chair, let me answer that one. As we indicated earlier on, we've recruited 3 engineers, and I think I'll summarize very quickly, including the Honorable Member, Madam Chair, that she was asking about this, how long should and why somebody cannot act. We are rotating the staff, and they're still new in the office, so they soon will be in their positions, and all of them we have assigned their duties. Thank you.
Waziri, I'm not an engineer, but you're taking us into your own circles.
Okay,
If
thank
you
you.
appointed someone and you want them to act, why can't they just act? And they are qualified, so that when they are acting, they can be rotated. You cannot tell me they cannot act and do the job.
Madam Chair.
Waziri, you want to...
Okay, stand guided, Madam Chair. Let's proceed.
Thank you, Madam Chair. I have 2 questions. You talked about the volunteers that you have in the department, and there's another term that came in, the employees who are in industry attachment. So what is the process? How do you engage them? And for how long is one supposed to be a volunteer in an office? And do you engage them formally, or it is again verbally?
Waziri, through your guidance, I can see Timothy, the hand is up. To the CEO, you proceed as well.
Okay, I think Madam Chair, allow me to be able to each one of my technical staff to assist on questions as they come.
Proceed, Waziri.
Yes, at any given time, we have attached to every engineer sub-county, so we take minimum so that we don't overstretch. We attach each sub-county engineer with 1 attachee for 3 months only.
How about the volunteer?
Volunteers, volunteer is a volunteer, so we don't really have a specification of how much one can volunteer. And as I said, we've limited, and I invited this house that as we regulate these policies, we bring our heads together so that we see and we come up with policies and regulations that legislates around how long we can have a volunteer.
So
now we don't
you want to
have.
tell us you can have a volunteer as long as 10 years? Is that true?
We are trying to avoid not to have any volunteer in the offices. at the
And
moment.
do they even come formally, or you again invite them verbally? The volunteers, I'm speaking about the volunteers.
We do not invite volunteer. Volunteer is volunteering by self.
Yes.
It's a self.
So someone comes into the department, handles the machineries, handle everything, the BQs and everything,
Madam
as a volunteer. He's not there formally.
Madam Chair, I had shed light on that one before. I think this together, we see how we can handle these situations and legislation.
Government equipments and documents, and is not there formally, I mean, in an official way in that office, is really a risk. It is not a question of even a policy. But someone being in the office as a volunteer for 4 years, and he has no letter containing in that department, is a risk. You are risking government equipments, you are risking government documents, and that one is not allowed, Madam Chair. So, Waziri, I think that one should not be the case. Even if you do not have a policy in place, I think...
Madam Chair, let that be a take home. We will respond that one appropriately at a given time because these people we found in office. Can I be allowed to respond at a later stage to that question, please?
Thank you, Madam Chair.
Waziri, you know you're on record. And we cannot just allow you to answer questions at your own time. It has to be, you have to tell us at what point. Because already you've told me you have three of them.
Yeah.
I'm not sure whether they are casuals. You've considered Celestine as one of the volunteers. I would want to see that report about the casual and the volunteers, but probably maybe they are that you are not aware. Maybe your chief officers are aware. So please proceed to produce a documentation about the volunteers and the casuals. And number two, I would like to know, you said you have 2 engineers who are qualified. It's you and who?
Myself, and there's an engineer called Engineer Millie.
Engineer Millie.
Yes.
Thank you. And I will want to close this session, honorable members. And before I close, let me allow you, if you have a question, members on your side, I can see Honorable Sharon is up, and Honorable Sialo, and we have our Mr. Katejo.
Okay.
Kindly give us your full names and your responsibility in this department, so that we are able to know you as well. So Katejo, proceed.
My name is Daniel Gatejwa. I'm a registered quantity surveyor, and principally assisting the Chief Officer Public Works. Thank you.
Honorable Sharon, proceed, and then Honorable Sialo, you take up.
Thank you. Let's go. I don't know, Geoffrey, you want to take up these questions, or Lekonaya, whoever would decide to take up this question on Millie. The only engineer, you and Lekonaya. Lekonaya and Millie are the only engineers that we have, qualified engineers, according to engineer Lekonaya. This Millie Odhiambo, she came in, when you advertised this job, what was the position that she applied for?
Roads Superintendent.
And what is her current position?
The same position.
Waziri, as she proceed, she's supposed to be a member of the engineering board as well.
Yes, she is.
Okay, you will proceed to give her, confirm that indeed she's a member.
Sure.
Okay.
Honorable Sharon, please.
Honorable Engineer, what prevents Millie from being our engineer now that she's duly qualified as an engineer?
Nothing. They were on probation, Madam Chair.
Are they still on probation?
Yes, because we have not received their confirmation from the Public Service Board. Yes, they are.
As a learned person, How long does the probation, when probation ends, what becomes of that employee?
Upon confirmation,
No, when it ends, according to the law. When the probation comes to an end, what becomes of that person?
kindly guide me, I am not a lawyer.
Okay, when the probation comes to an end, that person becomes an employee. And it's the duty of the employer now to give that person there. Because how long have they been in this place as our employees and under probation? How long?
They've been close to a year now.
Close to a year. So, is there anything, when you've done your letters, have you gotten any response from the service board?
Nope.
As to why they've not been confirmed?
Not, we are waiting.
Do you have any letters that you forwarded and you asked for their confirmation?
Yes, and my chief said that earlier on.
Lekonaya, do you have the letters and can you produce them here?
Yes, and we asked, Madam Chair, we asked that we will produce the
Honorable
letters.
Sharon, I made a ruling that they will document, they will table those documents in this committee before the close of the day.
Before the close of the day. And Lekonaya, now that someone who is acting and is supervising a project and is acting in the position of an acting engineer, what becomes of any mistake and is not a qualified engineer?
Madam Chair, I did indicate that in hand and we rotated through the departments. In fact, all approvals, all specifications, and most of the time, all structural works that needs a register are on rotation and are practicing. It is not that just sitting in office waiting for the letters, they are working. They are attached to several projects. And Madam Chair, I did make an indication that the engineer in question has been seconded for World Bank program under Ministry of Lands.
Understood. Understood.
And
my question is, you've not answered my question, Lekonaya. I've asked, just in case somebody who is not an engineer and is supervising a project, what happens to that project?
Madam Chair, I can only answer these questions if I am allowed to answer.
You're going to answer my question as I ask
Honorable Sharon and Waziri.
And if you don't want
Honorable
to answer my question,
allow me. Let's allow Waziri. I would want us to have a she's asking. It's not part of the questions, but it's also important in this department. On this issue, I think we are going around the circle. To me, Honorable Waziri, it's wrong for Engineer Kibor to be acting as the acting county engineer, and it's prudent that you correct this issue from today, because it's now out of the, it's now in the public domain. So please, Waziri, you're an engineer, a professional one. And even the questions that you're running away, it's clear that you know what you're supposed to be doing. Let's allow that point.
Let me just make one comment.
Okay.
And then I finish. Engineer Lekonaya is the head, the CCM of the roads department. The person who is acting as an engineer that is not even a registered member of Kenya Engineering Technicians and Technologies Board. He has said, and is the head, and he understands that if anything goes wrong and we lose public funds, it's because of his negligence and his failure is to show leadership in that place. Engineer Lekonaya, how can you have somebody who is acting as an engineer and is not even a member of a basic board called Kenya Engineering Technicians and Technologies Board, even though it's a personal decision? Remember, you're a leader. You're exposing the county. I can tell you for sure, even when I worked as an advocate, the people who I was working under and my bosses, they ensured by the time I'm going to court, I'm a registered member of law society, so that I don't expose my employer. So you're here just saying that it's a personal initiative, and you're the head. Remember, you are the head of that department. And lastly, there is no reason that Millie Odhiambo cannot take up that position of an acting of the county engineer. And if the establishment, if there is that establishment that has since abolished that particular position, and there was there an advertisement that was made for someone to fill up that position in this county recently? No? Okay. So I end my submissions by saying that Lekonaya cannot run away from his role as a supervisor of that department. And he cannot expose this county by saying them to do whatever they want to do, whether they want to be
by a county. Please take charge, and in the next live, we don't meet you at the same point, allowing people who are not qualified to act. And you're not even, it's unfair for Engineer Kibor that you are acting as the county engineer without even benefiting from that position. It's not even fair to him. So I will end there. Waziri, thank you for coming. Sergeant Atam, please work them out, because the issues that have been raised in this house, engineer, we will meet you in the next live. And you know what has happened with you in the earlier engagement in this house. It's only that we came maybe on the wrong hand, but now you're on the cross. Thank you. Proceed, Sergeant Atam, to work them out. Sergeant Atam, walk them in. CC Health and Services and your team, welcome. I'm the chair, Jeruto Kiptala, to the ADOC Public Service. My members kindly proceed to introduce yourself.
Thank you, Madam Chair. My name is Max Yalo. I'm MCA Mogotio and a member of this committee.
Chair, I am Aingwa John, member of this committee.
Wesley Lekakimon, MCA Jamsuat, member of this committee.
My name is Sharon Keter. I'm a member of this committee.
We have our member of the House. Kindly introduce yourself.
Thank you, Chair. My name is Honorable Sitoi David, MCA Bartabwa, a friend of the committee.
Waziri, proceed to introduce yourself and your team. As the clerk, our Wakili, prepare yourself to help them take an oath.
Thank you, Chair. My name is Dr. Solomon Serma, the CEC Health Services, and I've come with my chief officers, the Director of Medical Services and Medical Superintendent, BCRH, the Administrator. I would allow them to do self-introduction.
Thank you, Chair. My name is Evans Ruto, Chief Officer Public Health.
And other. My name is Nancy Chesire, Chief Officer Medical Health Services. Thank you.
Medical Superintendent of the County Referral Hospital, Baringo. Chair, my name is Michael Rotich, Administrator, PCRH.
Wakili, proceed.
I, Dr. Solomon Serma, do solemnly swear that everything that I say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God. Thank you.
I, Evans Ruto, do solemnly swear that everything that I'll say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God. Thank you.
I.
Kindly hold your Bible with your right hand.
I, Nancy Chesire, do swear that everything that I will say before this committee shall be the truth, only the truth, and nothing but the truth. Help me, God. Thank you.
I, Dr. Joseph Kangor, do solemnly swear that everything that I say before this committee shall be the truth, only the truth, and nothing but the truth.
Can Dagor kindly be audible? Because you are on record.
I, Dr. Joseph Kangor, do solemnly swear that everything that I'll say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God. Thank you.
I, Dr. Gershom Abakalwa, do solemnly swear that everything that I will say before this committee shall be the truth, only the truth and nothing but the truth. So help me God. Thank you. I, Michael Rotich, do solemnly swear that everything that I will say before this committee shall be the truth, only the truth, and nothing but the truth. So help me God.
Waziri, proceed to tell us about your academic qualification and your work experience. And you tell us how many casual, contractual, and volunteers do you have in your department, including those working at the sub-counties, and also provide the list of those working in the health facilities in the county. Proceed, Waziri.
Okay, thank you, Chair. I'm a medical doctor by profession, and I've specialized in a field called obstetric and gynecology. My work experience is more than 25 years. And I've worked in various areas. I've worked as an intern at Kenyatta National Hospital. I worked as an MO at MTRH. I did masters in University of Nairobi. Thereafter, I've been a medical superintendent at Kapsabet District Hospital. And I've been a consultant and a head of department at Provincial General Hospital, Nakuru. I've been a director for 5 years at Nakuru County. I've been a chief officer in Nakuru County for medical services for 4 years. And currently, I'm the CEC Health, Baringo County. Thank you. Now, I have a list of summary of casuals. That is, we have level 4, which are 352. We have level 2 and 3, they are 378. And we have a total of 730 casuals in the health department. The list.
Proceed to table the list to Waziri.
So I want to table the list of all the 730 casuals which have their names, IDs, and somewhat the remuneration they get.
Honorable Sialo.
Thank you, Madam Chair. I think I wanted Waziri to categorize those casuals per sub-counties so that we can be able to make up, have a clear picture and even do a follow-up as per sub-counties, like Mogotio sub-county, Eldama Ravine, and that is.
I have for Tier T, both East and West, we have 18 casuals.
Waziri, I think it's in order. If you're in your list, it's categorical, it's stated clearly. These are from Mogotio, these are from Tiati.
Yeah, it's well.
Then you be on record as well that all of them are categorized, that
Yes.
Mogotio, Ravine.
For all the sub-counties, the 6 sub-counties.
Okay, proceed to say how many are there in Mogotio?
Okay, Koibatek, which is Eldama Ravine, okay, then although they have not enumerated for Koibatek, but according to my count, I'm getting around 54. And Baringo North, these are for both the hospital and the health centers and the dispensaries. Baringo North is 24. No, sorry, it's 2. Baringo North is 72. Tiati West, 27. Marigat, which is Baringo South, is 31. Mogotio are 36. We have Eldama Ravine Sub-County Hospital. We have 58. And then we have a list of Mogotio sub-county rural health facilities, 65. think that's not true. This control sub-county, we have 53. And then we have Baringo County Referral Hospital. We have 193. And we have, at BCRH, we have 28 volunteers.
Waziri, let me allow you.
Point of correction.
Okay.
For sub-county of Koibatek, the first level 2 and 3 are 56, not 54.
Waziri, let me allow you to table the document as it is. Okay. Then we'll go to the details later. Honorable Sialo, proceed to ask your questions.
Thank you, Madam Chair. Waziri and your team, we would like to know the total budget that is used to pay the casuals, both the contractual volunteers and the volunteers, I mean, in the department. What is the budget that you have for the payment of this stuff? That is my first question. Second question is, what is your role in the engagement of these CEC, engagement of these casuals and volunteers as a CEC? And even the contractual staff, what is your role as a CEC? Is it your role to engage the CECs as engage the volunteers and casual and contractual staff as a CEC? Is it your role? I think you can answer the 3 or 4 questions, then I'll come with additional questions.
And before you proceed, Waziri, this document is not signed. It's not stamped anywhere. Please do the necessary as you proceed to answer your questions.
Waziri, I think you can respond. Those ones you can sign up when other questions will be proceeding. So proceed with responding the 3 questions from Honorable Shalo. Honorable Shalo, do you have any additional?
Yes, but I wanted him to answer the few so that we don't probably confuse.
Okay, proceed, Waziri.
About the budget, I think the available budget is now for BCRH alone, but I would like my two chief officers, the one of public health for the health centers and dispensaries, and the chief officer medical services for the level 4 hospitals.
Thank you, Waziri. Thank you, Chair. From the list we just tabled, we have an average of 730 casuals. And the average pay for casuals is between roughly around 10,000. So if you do the math, 730 times 10 is around it's an average figure. So 730 times 10,000 per casuals. Which is cap. Thank you.
Maybe through the chair, chief officer, you want to say all the casuals are paid flat rate of 10,000?
Thank you. Through the chair, that is just an average figure. There are some who are paid more, there are some who are paid less. Because most of them are contracted or need-based. Like, for example, like groundsmen who do the maybe clearing of or slashing the facility. They normally come on need base. So it can. I'm just doing an average figure. Thank you.
Chair, I think I'm really disappointed with this department because we've asked them. We need to know the number of casuals per either the sub-county and the level 4 hospital that we have across. But you have not that data. We've given you enough time. You had the entire week to provide the data. We're asking you about the budget that you have for these casuals. You are not even aware. You're giving us a flat rate of 10,000, which is not the truth. And this is the kind of the information that we wanted so that it can inform this committee whether you are doing the right thing or not.
I think there's some clarification here.
I think Waziri, what Honorable Shalo is saying, he wants to get some clarification on how you arrived on the 10,000 average. And therefore, you need to convince the committee that this is the reason why we arrived on the 10,000. Alternatively, you can give per cadre, because you have nurses, you have those working as security. Those you can of course break down so that, because these are issues about monetary and it is a motive issue. Therefore, the people of Baringo are watching and they want to see exactly how much are we spending on casuals in all our level 4 and our dispensaries. Therefore, I think Honorable Shalo is very clear. He wants some figures, yes, and how you arrived on those figures.
Absolutely, figures.
Thank you. Waziri, I think you are now guided on what the member wants and the committee wants.
That would guide us through the chair, will guide us to know the Department of Health, the casuals that are being engaged through the Department of Health, the ones who are working under the clinics and dispensaries. We will get to know their budget and probably their number. And then those who are working under the sub-county hospitals, we will have to know the budget. So that one, it is not even the matter of convincing. We just need figures and it will be clear for us. Just numbers, yeah.
I think
Waziri, you may proceed. May proceed.
Before the end of this session, I think we'll be able to get the total numbers or the amounts once it is tabulated, because we have the figures, but we have not done the total. And what the chief officer was talking about was the total number of casuals in both level 4 and level 2 and 3, which is 730. But for the level 2 and 3, there are 378 casuals. And they are paid according whether it's a technical office, technical staff, there is a watchman and a cleaner. There are two categories in level 2 and 3. The figures that we'll have exact is from BCRH, but before the end of this session, we'll be able to get for all the level 4 hospitals because we have the figures. It's only that we have not given the total numbers.
Through the
that
chair,
they are
I
paying.
think, CC Sirma, you know, our casuals have not been paid for so long.
Yeah.
And that is why we are here. We are trying to find out what is the reason behind this. As an hospital, you collect revenue. And before you pay these casuals, as a chief officer, definitely you know. Every month for my casuals in my department, this is the amount I'm paying. But unfortunately, you have no idea, as the chief officer, public health and medical services, you have no idea of the amount you're paying, the budget you're paying these casuals. Who knows, out of these 730, we could be having ghost casuals. And that could be the reason why you do not want to disclose the budget that you're having in every department. So, Madam Chair, I think we need your guidance on this, because this is a risk. There's a suspicion there, probably. We have casual workers who are being paid and we are not aware. So unless that information reaches our desk, I think we will treat that as a...
Honorable Locales, proceed.
Chair, I think when you are away, there is this issue of how much are the casual paid. Their total number, of course, the CEO and the CEC are on top of the issues. They should be able to tell the committee how much are they paying per month, because these are money from the county coffers, and we must get exact figures so that we cannot assume that we are paying 7.3 million per month. Yet, if we go deeper and get some figures, we may get even more than that 7.3 or less. Who knows? Therefore, Madam Chair, I think the committee must substantiate to this committee, the CEC and his team, substantiate to this committee so that the members of the public and this committee should be able to be convinced on the amount vis-a-vis the number of casuals they are being paid. That 730 are many people. Therefore, we want to get some figures, in fact, clear figures. Clear figures. Thank you, Madam Chair.
I think on that point, it's in order, Waziri, we can give you time. You do a comprehensive report about that. And how long are you going to take? So that you may bring the issues about the number of casual workers, how many are they being paid, and probably on the issue of Honorable Sialo, that you categorize them under their own hospital. Like if it's Mogotio, it's Mogotio only. When it's an health center somewhere, it's as it is. Proceed, Waziri.
No, I'm sure we'll be able to give the response before the close of the day today by 5.
Noted, Waziri. Proceed, Sialo.
The other question, Honorable Ciel, was asked whether I have a role in the recruitment of casuals. What I'll say is that I have got no role as a CEC in the recruitment of casuals. Casuals are recruited at the facility level, and there is a procedure that is followed by the in-charges in recruiting casuals.
Okay, Dr. Sirma, you want to say in the department where you work, you do not have casuals. All the casuals are based at either the sub-county hospital or the dispensaries.
You know, we have only, you know, in our offices, I can't really say that these are staff that I met and they are still there. And I have no role.
They are casuals in your office?
Maybe 1 or 2.
Waziri, you're not sure of your staff in the office?
No, I've been confirmed. We have got no casuals
Really?
at the office.
Okay, whose responsibility is it to engage, I mean, to employ these casuals at the hospital level?
At the hospital level, it is the, you know, we have, up in level 4, we have board members of the hospital. Those are the ones who usually engage these casuals. And at the facility, level 2 and 3, we have health facility management committee who do the recruitment.
Okay.
On the issue, Honorable Sialo, of casuals, are you aware of 2 casuals from PCRH who are at your office?
Casuals. You know, those ones, unless they were seconded, but they belong to BCRH.
But the
At
point
my
is they are
office-
casuals and they're in your office.
I know of an accountant who is a casual paid by BCRH.
And they are working in your office or PCRH,
They work at the accounts department.
at the PCRH.
One is at BCRH and one is at our office.
Honorable Sialo, proceed.
Thank you, Wazir. You've said you have no role in the employment of those the casuals, and you've stated how they are being engaged.
Yes.
Recently, when we visited our BCRH, we found the MedSup, Dr. Obakalwa, and we noticed that there were some strangers in the hospital.
Strangers?
Yes. But if I may quote the medicine, because he was on leave for about a month or so, and when he came, he realized that there were new casuals who were strangers to him. And when he asked him, whom do you think is responsible, he was like, I don't know, because he has not received any communication on the engagement of those new casuals, but they were already at work. So that means it was not the board, because we investigated and we realized that the board had not sat. So it was either Wabakalo himself or the admin who is before us this afternoon. So the admin can even shed more light that who brought them on board and on whose instructions were they engaged. And did we have budget for the strangers in the hospital?
I think the BCRH or the administrator. I think you should shed more light.
Mr. Rotich, proceed.
Thank you, Chair. I did mention that the strangers which were mentioned, there were 4, and these were purely people who came to volunteer. They were not engaged by the hospital.
Are you sure?
Yes.
Admin?
Yes, I'm very sure.
So they came out acting through your office?
They came as volunteers. They were not. They have not been engaged. Yes.
Do you have
they were
formal
not
letters?
engaged.
Do you have
yes, the
formal
letters are there.
For the 4?
Yes, the letters are there.
Can you table before this honorable house?
They are in the office. It can be tabled. In
Through the
course of the
chairman,
day.
if we can table the letters by end of day today, I think we will be comfortable with that.
I think, admin, you'd also be specific that there are 4 volunteers and they were engaged by who?
Yes, they were nurses. There was a requirement because some nurses left.
Mr. Rotich,
Yes.
I've just asked a question. Who
Yes.
engaged them?
They were engaged by the Department of Nursing because there was a shortage. There was a clearing shortage.
Who specifically?
The matron.
Okay, Honorable Sialo, proceed.
So, Mr. Rotich, you want to tell us the matron has powers to engage casuals at his own wish and volition?
When those ones who were there, honorable member, left, there was a vacuum in the specific department, so there was need to put people to cover for that period when there was work must continue. And especially a place like maternity, if one officer leaves, then we get exposed if there is no replacement.
So you did not consult, she did not consult as a matron, she did not consult you?
We
as an
consulted those who were present at the time of work. We consulted, and we saw there was need.
Did you inform the MEDSUP of that action and the consultation?
The MEDSUP was on leave.
Yes, even if he's on leave, you are supposed to consult.
We normally meet every month, and a meeting was coming up, and it was going to be well briefed. There was a report which had been done, so it was going to be well briefed because we review these casuals every month. So we were to have a meeting.
Okay, let me cut you short a bit. Cherotich, you heard Waziri say, it is the board that does the recruitment. Did you even engage the board yourself, the chair? Or you just consulted with your matron and you ended up employing these people?
Every time, honorable member, we had a meeting and we shared with the board that there is a very big shortage. And the board was aware that the shortage is there of both nurses, of medical doctors, and the board was kind enough to say, if you see the decision that you make, they will stand by it.
Let me ask you, Cherotich, as an admin.
Yes.
Do you have the board's resolution giving you instructions to hire?
We have the minutes. We have the minutes to that effect.
When was the last board meeting of the BCRH?
It was in April. April, I think. Yeah.
April. And when did the MEDSUP went for leave?
We had a meeting shortly before we left for leave.
So through the chair,
we had a board meeting.
Through the chair,
we had a board meeting in Jeptebo. It should have been the first week of April, and then he left for leave.
Through the chair, I think the admin should table the minutes and the resolution of the board, giving you instructions to employ those nurses. But if we don't find them, then that means you'll be in trouble. And if I may ask you again, admin, for how long have you been the administrator of the BCRH?
1.5 years.
1.5 years.
But I was there also for 2 years. So it is in total is 3.5 years.
What was your previous work before joining the hospital as an admin?
I was the municipal manager.
Municipal manager?
Yes.
So you moved from being a municipal manager to the administrator of the hospital?
Yes.
You went there formally or it was verbally?
It was done officially.
Officially, you have all the letters?
Of course.
So kindly table them. And finally, do you think you're suitable to be the admin of a BCRH hospital? Having no experience elsewhere as a hospital administrator. You've just been taken from a municipal to being an admin of a serious hospital in Baringo, BCRH Baringo, as an admin.
I have been in management, Honorable Chair, in various capacities, both in national government and in county government. So I have the requisite qualifications to be a manager.
Honorable Sial, on that note, Mr. Rotich, since you've noted that you're in national government, which department were you then?
I was in Trade, Minister of Trade.
Thank you. And Waziri, I would like to know, before engaging any casual or volunteer, what is the procedure at the PCRH? Because noting enough that a matron can just wake up one morning and just call people to volunteer in a very serious hospital like that, and there are only 4.
The procedure is there should be a request, a formal request from the heads of department that they need of a particular healthcare worker, and that one is usually presented at the hospital management team meetings.
Who are these management team?
they are heads of departments
Yes.
of the hospitals, from nurse, the head of biochemistry, the head of dental, head of lab, and so forth. And then when they meet, before they request, there should be a budget before recruiting. They should demonstrate that there is a budget, and that one is presented to the board during the board meeting. If it is agreed that there is a budget, they usually write to the chief officer requesting to recruit an healthcare worker. From there, the chief officer will seek permission from a county secretary and head of public service, requesting the county public service board to give an approval for engagement. Once they give the approval, then they engage. Thank you.
Honorable Sialo?
Thank you. Waziri, you've heard what your staff, who is the admin of the hospital, said. Do you think, in your opinion, do you think that was right for him just to sit with the matron and decide to engage those nurses? Though he's calling them casuals, but they are nurses. Do you think it was right?
He's calling them volunteers, not even
Volunteers,
casuals.
yes.
But I've said of the procedure, if that procedure was not followed, that is not right.
Okay. Admin, how many casuals do you have in BCRH? Sorry?
193.
193.
Yes.
When was the last date you engaged casuals?
Should be April.
April. After the board sat and gave you the approval?
Yes.
Okay. Waziri, I know you are aware that these casuals have not been paid for long. Why is it that they've not been paying for all that period of time? Was it the issue of a budget?
Yes, usually it's the issue of the budget. You see, when you talk of casuals at the level 2 and 3, where the budget comes from are two areas. There is the Danida Fund from the Dutch government, where they usually allocate funds to a facility according to their workload. And there is the monies from the county government, which is called the foregone use fee. That is usually given to a facility. And there is funds that is called counter matching. When they need, like for example, this financial year, this will be their last engagement, they'll be contributing 40%, the Danida funds, and the county government contributes 60%. These monies is usually for operation and maintenance of that facility. And at times, it do delays in the disbursement.
I need some more clarification. These donor funds that we get, the Danida funds and what have you, I think they come to the county with specific specific assignment.
Yes.
Not to pay casuals. Probably some are for the drugs, probably some of something else or equipment. But do we use the funds that we get from the donors to pay our casuals?
Yes, cumulatively. We don't buy drugs with them. It's for operation and maintenance.
Okay.
Yeah.
Now, Waziri,
small repairs.
Waziri, these casuals are very informed. I've heard what you've said. Yes, thank you. These casuals are very informed. We went through, round. They are aware of the FIF bill. And they said, we were told, as soon as the FIF bill is passed, we will get funds and the hospital will be paying us directly. But unfortunately, we've not been paid. And they were asking us, does it mean that you did not conclude passing the bill in the assembly? Now we were told them, no, we cleared on it. Then it was clear that there was something in the department. So Waziri, I want you to explain to us, why is it that the FIF bill is not working? Why is it that BCRH have not received their funds, and these are the sub-county hospital up to this moment.
To make it clear, initially there was no F5 for level 2 and 3. Services have always been free. But for level 4 and level 4, there has been F5 even before devolution. Things were working well before devolution because counties' monies used to go directly to the account of that level 4, particular level 4 hospital, which was ring-fenced. But after devolution, all the county revenue money goes to the county revenue account fund. That is why we were advised to do an F5 Act, so that money can go directly to that facility and it is used without being swept or swiped to the county revenue account.
Okay, Waziri, so that we don't take much time on that matter, why is it that the F5 is not working? Okay, we've known before devolution there were historical things that happened, but why is it not happening now?
The FIF Act,
why is it not
we
working?
passed it. It needs to be implemented, and the people who need to assist us is county treasury. That they need to assist us to operationalize, because signatories of the FIF collection is at treasury. Now, I've written to the CEC treasury to assist us to operationalize FIF.
What was their response?
Good enough, he has appointed a committee to work on operationalization of the F5 Act. We are waiting for the regulations, how to go about it. We have it with us now.
Okay.
So I don't know, and the chair of operationalization is the Chief Officer County Public, Chief Officer Public Health. I think he should tell us how far he has gone.
Maybe, are you aware, Waziri and your team, that Mogotio is, FIF is functioning in Mogotio? And why is it functioning in Mogotio? Not in Kabarnet, especially BCRH, and these are the level 4 hospitals. And we want to be, let's be sincere. If you think that problem lies with the finance department, then you be sincere to us so that we can assist our people to get medication and drugs at the right time. Someone must take responsibility of this. So we want to know, is it you or the finance department? And if it is finance, who in particular can respond?
For Mogotio, you know, the account was opened much later than others. And the person who usually does the swiping of funds from the hospital revenue account, there are 2 officers at Treasury who are in charge of that. Yeah.
Who and who?
One is a director, and the other one is somebody in charge of revenue.
Waziri, you know them, just mention them. I think we said
There's Mr. Rerimoy and Siror.
Siror, Director Revenue.
Yeah.
So these are the people who should take responsibility.
I think they need instructions from the CC Treasury.
Okay, okay.
Yeah.
Madam Chair, Waziri, we have medical officers who've been going on study leave. Currently, how many of them are on study leave from our county? How many returned and offered services within the required period of time? And how many of them left? And what actions did you do against those who left without completing their probation period?
Okay, now the doctors are directly under the supervision of our Director of Medical Services. I think he has all that information. I think I want to give him a chance.
Before he proceeds, I think Honorable Sialo should get answers from the CEO Ruto, so that we move on. And please, as you highlight, tell us when did the FIF bill become an act as you proceed. Okay, Honorable Lokales, can you do the addition?
When Mr. Ruto will be replying on the issues of FIF under the committee which has been formed, I want also him to shed light on his role that he has performed so far to ensure that all the level 4s hospital have a working FIF. And it is clocking to now 5 months after we passed this FIF bill. With all that 5 months, what was the difficulty of the Department of Health to operationalize the FIF funds? 5 months down the line, no operationalization. Thank you, Chair.
Proceed, CEO Ruto.
Thank you, Honorable Chair. You have asked me 2 questions. And the FIF was gazetted in February this year, 18th. I have a copy with me. And we needed to come up with the regulations on how to operationalize this FIF Act. I also have with me here a copy of the regulations which is ready. And the reason as to why we could not operationalize the FIF then was it is because it was close to a mid-year of the financial year. And some contents of this FIF year, the FIF Act, needed to run.
The mid-year you are talking about
February.
is February.
Yes, needed to run through a complete financial year. So even in the regulations that we have come up with, we need to operationalize this FIF Act as from 1st of July, because some of the requirements as per the Act is that we needed to.
And why is Mogotio operational?
The one for Mogotio is they are using the old, the National FIF Act. What we did as a county is that we have an hybrid FIF Act. We borrowed every from the national government that was passed by the National Assembly, but the one that we are operationalizing now as a county is an hybrid that we incorporated, you know.
So what will happen to Mogotio, which is operational on an old FIF?
They will have to use the new FIF Act because it's been passed, it's in law now, and we need to operationalize it from 1st of July.
So you want to tell me you're on the wrong that Mogotio is operational on a old FIF bill, and you're now saying the hybrid one is the one which is gazetted?
Honorable Chair, I think it is good to go on record that all our level 4 hospitals, the 7 sub-county hospitals, are using the FIF.
Madam Chair.
But Marigat is not, Marigat is not, the FIF bill is not working in Marigat. Be guided that we went round these hospitals. And when Honorable Sialo is making his submissions, they are factual. It's factual from the med-subs from those hospitals. So as you made an illustration, be aware that we went there and we have their own submissions here and they are on record. CEO, proceed.
I think we have an officer who has worked there as a medical superintendent and is the one who opened our account. I think I want Dr. Kangor to shed more light why Mogotio is working and not the others.
Madam Chair, before Kangor probably comes in.
Proceed, Honorable Sialo.
I think from what the CEO has said, that Mogotio is using the FIF, the national FIF. So does it mean that the FIF, the national FIF is not applicable to the other sub-counties, but it applies only particularly to Mogotio? You've said that FIF came mid-term. That's why the other sub-counties do not benefit. But I'm asking, is the national government FIF applicable to Mogotio alone and not on the other sub-county hospitals?
And Chair, so that the same question.
Proceed, Honorable Lokales.
So that we can find out the same question, I just want to give an interjection that when it's half year, when it is mid-year, and funds are available in the accounts, was it a crime? Was it somewhere in the clauses that you should not spend this money when you are already a half year? Is there anywhere in that bill which prohibits the level 4 hospital using this money when it's already a half year? Money can be funded at any time, be it mid-year, be it early year, so long as by the close of financial year, you have done the balance of your accounts. What was the difficulty anyway? Was there such a clause so that you now are saying, no, we cannot use this money until 1st of July. This money, we will keep it there. We cannot touch it because the law says that. Maybe you tell us more about that bill, if it says like that.
Let me clarify. Apart from, I'll still give a chance to Kangor, because for clarity purposes, and the issue of availability of funds in the whole dispensation before this FIF Act was enacted, we are usually given by Treasury a ceiling to spend up to 45. And since we came to the office, we have always surpassed the ceiling. So once you have reached the ceiling, if it is around, if we have, for example, 100 million, and we collect 20 million, we'll not be able to spend the 20 million unless maybe it is put in the supplementary budget, because we usually surpass our ceiling. But with the enactment of this FIF Act, we shall be free. If we have collected up to 500 billion, nobody is going to give us a ceiling, whether it is the end of the year or the beginning of the financial year.
So, Chair, which law now are you using? Are you using the old law that were giving you prohibition not to go beyond the ceiling, or you are using the new bill of FIF which was passed by this House, of course?
The old law, because we have not operationalized the new FIF Act.
CEO Ruto, I need you to finish your clarification about what you are being asked, so that Kangor comes in to give us the issue of Mogotio.
Thank you, Honorable Chair. I said earlier, the act I have here with me, it was passed. It was passed in February 18th, and we formed a committee of which me and my colleague, the Chief Office of Medical Services, are members, and we were working on the regulations, and the regulations are ready. And Honorable Chair, I think we will operationalize fully this FIF Act as from 1st of July. Thank you.
Proceed, Kangor.
Yeah, thank you, Honorable Chair. Allow me to comment on the FIF Act. We have two acts. We have the National FIF Act, which is Facility Improvement Fund, which has a limit. And actually it has never been repealed, so it's still on. And that's why some counties like Nakuru have been using that even before they passed their own Facility Improvement Financing Act, which is actually the one which was passed in Baringo County. So honestly speaking, the counties who actually continue with the National FIF Act, they are not the only customizing to suit the current dispensation. In terms of Mogotio Sub-County Hospital, that account has been on. It has never been. I actually found it on its own, and their funds have been coming through the same account, that is revenue. And for Mogotio, they have been lucky to be able to utilize the FIF funds to run the hospital activities, and it's been, to me, it's been a good example to the others. It's so unfortunate that hospitals like BCRH are not able to enjoy the privileges of actualizing the FIF Act, unlike Mogotio, which which their funds come to the facility account and they're able to request for NEI and spend as per the FIF Act.
Honorable Sialo.
Through Madam Chair, I think for Mogotio case, we actually pushed for them to open that account. And that doesn't mean the other sub-counties are not able to open this account. So it is someone somewhere who did not want to do his work as required. Because I believe whatever we are enjoying in Mogotio should be enjoyed across the county. But because someone probably wants to be pushed around to do what is required to do, has brought all these problems. You can imagine what the BCRH Abakalo is going through. We have the reason why we are having several referrals in Kabarnet is because they do not have access to the funds. So, Waziri, your department, yes.
Okay. Honorable Sialo, as you wind up, will allow
So
Sharon to still inform you or about the issue of FIF probably.
We are done. We'll give him time, Madam Chair. There was this issue of the medics who've gone for study leave. You've not responded to that. And on that note, there's this issue of Dr. Chepchieng, who went to Uganda for studies, and he was released by the Chief Officer, then Chief Officer Bore, to go study. Unfortunately, you've recalled him at a point that he's spent his money paying school fees and is midway studying, and you are again recalling him to come back. Is that really fair? And in that case, who is supposed to give out this study leave? Is it the chief officer, or the medsup, or the county secretary, or even the board? What is the procedure of approving these medics who want to go for study leave? I mean, yeah.
Waziri.
Waziri.
First to answer about the medics who are on study leave, and then I'll give CEO Medical Services to answer the release of staff for further studies.
Through Honorable Chair, we actually have 18 doctors who are pursuing their specialization courses in various universities. And out of the 18, two of them, that is Dr. Lexon Kiprotich and Dr. Intisa Said, were recalled, and they never responded, and actually they are on salary stoppage, courtesy of that. We have 2 pharmacists.
Sorry, through the chair. What was the reasons of recalling the two, the Lexon and Said?
They were supposed to report back by September.
So they've not reported back?
Yeah, they never. And actually we were forced to stop their salaries.
Okay, proceed.
Banning them reporting back. We have 2 pharmacists who left outside the country. One was to pursue a Doctor of Philosophy in Pharmacy, that is Dr. Chebon, in a university in Australia. But he made a special request to leave of absence. He requested for a leave of absence, which was granted, and that is why his salary stopped. So it's not on the counties, our county's cost.
So, excuse me, Doctor, who's giving out all these approvals?
They go through the normal process where they request for study leave, which we actually discuss at Department Human Resource Advisory Committee meeting. Once approved, it's actually passed to the County Human Resource Advisory Committee, that is the CHIRAC, for now approval, depending on the request and the need.
So you want to say all the approvals went through CHIRAC?
Yes, they went through DIRAC and CHIRAC.
And as a department and as a committee, you saw it right to release 18 doctors, medics, to go on study leave, leaving our BCRH hospital to be run by casuals.
Through Honorable Chair, they're actually at different stages of their studies, and I want to report that we are expecting around 4 of them to report in September this year, and others in the course of next year. We actually found some of them, they already gone present to school, like around, that's Lexon, Dr. Indisa, Abbas, around 10 of them had actually presented to school even when we came into office. But they're actually almost completing their studies. My input about doctors going to school, it's part of development in the department. One, initially they are medical officers, but once they specialize, they become specialists. And I believe as a county, we still need more specialists on top of the current specialists which we have in our county.
Madam Chair, I think, Dr. you've said, imagine releasing 18 at the same time. You're trying to justify that it is a requirement. You're trying to develop their career. But unfortunately, again, we are developing their career and they come and leave without working within that period that is required, the probation period. They don't serve within the county. Now, you also have to confirm how many of them did not follow the regulation, did not work with us within that period of time, and what are you going to do to them? Because they spent our government money and they have not come back to give us services.
Yeah, through Honorable Chair, they are all bonded for a minimum of the number of years they've gone to school. If it's a 4-year course, they are bonded for 4 years. If it's a 5-year course, they are bonded for 5 years. And I believe once they come back, they'll actually give value to the investment we put in them.
Dr. on that note, you want to say all of them came back and bonded for the number of years you're saying?
Yeah, like the ones who've come back, they've been bonded and they're actually serving.
We do not have some of them who went without even serving.
Except, I think there are 3
now
who actually transferred on what you call government to government service. Like I know of a psychiatrist who transferred to Ministry of Defense.
So that one is allowed even if they have not finished the bonding?
It's allowed by law. Through Public Service Commission. Yes. It's government to government service. So long as somebody is not leaving the government.
So that means these people can just come through Baringo, we pay them school fees, and then they leave.
No, not as such.
That is what is happening now. Because already the ones who've gone to abroad are 2. These are the ones you've said there are 3. Those are 5 out of 18. You've recalled 2 who did not serve within that period, the bonding period.
And we stopped the salaries, yes.
You've stopped the salaries. The ones who went abroad, they've been earning in abroad.
No, we stopped the salaries, the 2 of them.
So what is going to happen to the money they've been earning?
Actually, we utilized their pay to engage last year, the 6 medical officers on a 6-year contract, pending confirmation. Once we confirm that these officers are no longer coming back to our county.
Chair,
Probably, Chair, before my colleague comes in. We want the approvals of all the medics who've gone on study leave. We want to see the disciplinary actions that has been taken against those who went to abroad and they were still earning from our county. The ones you've recalled also want to see probably the letters you've written to them, recalling them, and the last action that you've taken, so that that matter can be concluded.
Yeah, through the chair will provide
before we conclude, how long have you been in Baringo?
More than 2 years now. But I worked in Baringo even before I left to Nandi.
I'll just ask how long have you been here?
The last 2 years.
Honorable Locales.
Thank you. Thank you, Chair. I think I need to understand something, Chair. Just like a layman person who doesn't have a background of health in Baringo, that mama from Kisanana wants to know. You have 18 doctors working with you. And let's say 18 doctors, you have 18. Then this month, 4 of them request to go for study leave. You sit down, you approve. After 2 months, other 4 come, again seeking your approval. you approve. The others have gone for 2 months and they are going for 3 years. Then other two come after like 3 months, you approve. Then you approve for 4 years. And then another slot of 4 come and you approve. When you are doing the approval, when you are sitting down, the CHIRAC, the board, and the county CCM, county CEO of medical services are in the know that they released 4 months ago or 2 years ago, they released these doctors and none has come back. And you go ahead to approve for more to go. What are you trying to insinuate to the people of Baringo? The BCRH or any level 4 hospital is left without a doctor. Then now again you come sit down, say, we don't have a doctor, will let us hire some contractual or casual doctors so that they can help us. You are paying the others still on leave. You are paying money meant for Baringo people. Then you hire extra one because of the fault or your own fault of approving for more doctors to go on leave. You use again taxpayers' money to hire more doctors, and you continue. When again you have around 2, you continue hiring. What are you trying to tell us? The normal person, there's ule mama mwenye anatoka huko Kirioko, ajue kwamba these doctors are living with your approval. They are not going by their own. Even if today I am applying for specialists somewhere to go and specialize in anything, and my time, I am told by my bosses, we have given many people to leave and therefore we are rejecting your offer. So this board plus a CHIRAC plus a CEC plus a CS, you are just rubber stamping any request coming before you, rubber stamping. If I say that you must have been bribed by the same doctors so that you are approving anyone coming, you are using them to gain money so that anybody coming, his approval is just given. Can you give us an example of those you have turned down their offers today, if they are there?
Honorable Engo.
Thank you, Madam Chair. I think this is where the rubber meets the road. I believe in many cases, Honorable Chair, many of our referrals from Gabarnet to Eldoret is because one of the reasons is because we lack specialists who can attend to the patients here in PCRH. Madam Chair, I wanted maybe them to tell us, when you are employed today as a doctor in our county, is there a prerequisite time you are supposed to serve before requesting to go for study leave? There's one. Another one, Madam Chair, is how many doctors do we have in Baringo? And in Baringo generally, so that maybe you tell us per sub-county how many are there. And then also what informs the approval? What informs the approvals? I think that is when we can actually say you are in charge, or what Honorable Locales is saying is true. What informs you that we must release these doctors? Madam Chair, budgetary implications. Budgetary implications of doctors who go. And this is actually where we have suffered a lot, if I'm not wrong. We have suffered a lot because of this. I know development of career to being a specialist, that is all right. But we must have a sequence. We must have a sequence. We must have a procedure so that we don't go for further studies, leaving our patients without doctors. Maybe so that I don't deal so much. They should answer us.
Waziri, proceed with the answers of Honorable Ayengo and Leka Kimon.
Okay.
Local
Sorry, Chair. Career progression is encouraged, not only in the county, even national government. And we should know that these doctors left at different stages. They were not all 18 released at once. And some of them, when they apply to go for postgraduate, most of them we don't release them. We usually request them to defer for 1 year. And they can be only allowed
I
to
think
defer
Waziri,
for 1
before
year.
you proceed,
And then I want
a
to
point
make
of, point of information so that you proceed, because you are digressing before you. We want to know at what level do they live. If I'm employed today as a doctor in Baringo, for how long should I work so that I start applying for study leave?
It's a minimum of 2 years. You should work for the county. And then we have gone ahead now that we just don't release anybody anymore. We have something called training needs assessment. We can only release somebody if we know those, if we need those specialized
Waziri, you are going to
courses.
defense and you are not answering these honorable members. Why are you going to defense? When you start saying we've started now regulating these doctors, you've not even illustrated the issue of Honorable Locales. You've not illustrated the issues of Honorable Laengo. They've just asked you, like the one I've interjected, I thought you will pick from there and proceed. Like, talk to me like a mama in Salawa. How do doctors transit to those going to further studies, finish, come back? Honorable Laengo, please go back to those questions so that you can stick to the question and give us the answers.
I think I asked how many doctors we have in Baringo and Basab County, and then how long he has answered, how long they take before they request for study leave. And then another question I wanted to ask is, as we have that space of 18 doctors on study leave, maybe going on different stages, which is all right, but do you have a replacement of the same 18 doctors? And are they procedurally brought in to serve for areas the doctors have left? Or we just, that is it, Madam Chair.
Honorable Sharon, you add your point so that you can be able to answer.
Thank you, Chair. I've heard the doctor saying that nowadays they don't release, they've stopped. And I'm here wondering, they've stopped because we don't have doctors anymore. They have all been released. So, I mean, and one thing I want to comment on is this issue of career progression. It's something that is highly encouraged. But at what point do you balance career progression and the sustenance of the hospital? Because as we speak, we don't have those people that you're calling, we don't have the experts, as you're saying, and worse still is that we are the doctors who are working currently are those who are in casuals, who are working in 1 year contracts, I think, and below. So at what point do you balance the sustenance and the running of the hospital and career progression? And also, a last question is that you said that there are 3 doctors who came back and left. These are people that they say that according to the law, they are allowed to transfer across. What if these doctors come back again and then they are transferred because the law allows? Is there anything that can be done so that we are able to sustain the BCRH? Because as we speak, the BCRH that was a referral hospital, it's a level 4 hospital, owing to this mismanagement of the office, of the hospital. So how can we balance this thing? Thank you.
Honorable Siala, then we allow them to answer so that we don't ask a lot of questions and
Yes.
they don't give us answers.
I stand
Proceed,
guided,
Honorable
Madam Chair.
Siala.
I thought that the question that I have is in regards to what we are. I want to know how much is, on an average, how much is a doctor earning? And number two, those who are on study leave, are they paid their full salary? Or when someone is in study leave, is paid half salary? And then an issue that arose when we were in BCRH, there are these consultants that we have. How many of them do you have specifically for BCRH? And what times do they come? Because there was a complaint that some of them just come for, they visit the wards, and in fact, they even refer patients from our BCRH to their local hospitals that they own within Kabarnet. So is that allowed? Thank you.
Proceed, Waziri.
Okay, I think Dr. Ngor, you'll answer how many doctors, because I don't have the numbers now that we have. And also how much they earn. There are some who have come and left. And how much they earn. You know, I was a doctor 3 years ago who was earning a salary for a specialist. So I don't know. And there has been always increment. There is an yearly increment. I know there is something called a CBA. So
Waziri, I want you to proceed with the few
Madam,
points. And
to the
there's
chair.
something, let me add on something. At least now you came from the hospital in PGH in Nakuru. I went there with a child, a patient. In Nakuru, I want you to tell us between the difference between now our hospital, PCRH, and that one of Nakuru, where a pediatrician sits from morning to evening to attend to children. And in our hospital here, we don't have that pediatrician sitting from morning to evening. I would want, as you answer their questions, I want you to help me understand how can we be like in Nakuru, where our specialist sits in hospital to see our children when they come there, as you proceed with their questions.
Madam Chair, Dr. Sirma is trying to actually avoid my question. Sirma, let's be honest. Unless you want to provoke us. Let's be honest. I'm a cool person, but if you want to provoke us, then we'll get there. I asked you, on an average, how much does a doctor earn in Baringo? And the second question was, those who are on study leave, are they earning full salary when on study leave or half salary?
I know what a consultant's earns is around 300,000 Kenya shillings. For a medical officer, it should be around 200, average 200.
Let him.
Honorable
Chair,
let's be on record.
Chair, I feel the doctor is not sure of what he's telling this committee. And Chair, don't take us that part where somebody wants to maneuver to avoid answering specific questions. From the word go, my questions were not answered. The questions of Honorable Engo were not answered. The questions of Honorable Shallow were not answered. If the doctor is not sure of what he's saying, let him delegate to his two chief officers. He has the superintendent here. He has the administrator here. If he's not sure of what he's telling this committee, let him shut up and allow others to speak. Chair, we are losing our patience on this one. Thank you.
I think, Waziri, you can see the feelings of the members, and the same on my side. You will.
Are working in this PCRH like doctors.
and because of you. The way you talk, and your CEOs are just looking at you, lie to this house. Chief officers. At least in the last department, I could see CEOs whispering to their CECs. You want to tell me, CEO Ruto, you don't know how much a doctor earns? CEO Jesira, you don't know how much a doctor earns? You think you've come to this house to reserve your answers and we'll let you go. We still have questions for you and you will answer. Waziri, proceed from the questions from Honorable Laengo. And we are not going to repeat those questions. I want you to start from the questions from Honorable Laengo so that we see if are we together or you are sleeping. Proceed.
Chair, although I had already delegated.
Waziri, do you listen? I've said answer the questions from Honorable Laengo. Is it difficult?
I want Dr. Kangor to answer how many doctors we have, so that I don't want to make a mistake.
Honorable Selma, did you remember the questions from Honorable Laengo?
It is how many doctors that we have. No, how much they are earning from Honorable Sia, about the study, whether they are still being paid full amount. Yeah.
Again, you can proceed to the questions of Honorable Laengo. And if you don't still remember, please allow the member to ask you the same questions.
Yeah, thank you, Madam Chair. In terms of the number of doctors, we're actually 74 in number, against a population of several and 60,000. Allow me to dissect the doctors on study based on need. Then I want to approach it the other way around. One, I've talked about the four whom you have actually stopped their salaries. Now for the others, like one doctor called Dr. Abbas Ali Haji, who is pursuing Masters of Medicine, internal medicine. That means when he comes back, he'll be a physician. As you speak, you will have one physician in Baringo County. That is in BCRH. Once he proceeds on leave, we don't have a physician in the whole of Baringo County. So there's a need for us to have a physician. We have one doctor who is pursuing Masters of Medicine in psychiatry. As you speak, we don't have a psychiatrist in Baringo County at the moment. And thank God she's reporting back in September this year. We only have a surgeon, one surgeon in BCRH and one surgeon in El Maravini. Once that surgeon proceeds on leave, we miss surgical services in our facilities. That is at the county referral, or even in El Maravini, which is our second biggest facility in the county. We also have other theaters, like in Mogocho, which actually needs a surgeon. And like enough, among the team, we have one doctor who is pursuing Masters in Surgery at Moi University, expected to be back in September 2026. In our breakdown, even before we leave doctors on study leave, there's a minimum period of time where they have to work, minimum of 2 years. Then now we release them based on the need. Amongst all this team of 14 doctors, they're actually based on need as a county. We have to grow as a county. So we need these doctors as specialists. So that we stop referring these doctors to MTH.
Honorable Siala.
Thank you, Madam Chair. Dr. You've just told us that most of those doctors, the president is that they don't come back. So how sure are we that the 14, already you stopped the salaries for the other 4, the 14 will come back? Because you help them grow, develop their career. Then when they come back, they would want to work in a high hospital. They will not want to come to a BCRH where things are not working. So what are the measures that you are going to put in place to ensure that when they come back, they will be retained here for that period of time?
Through Madam Chair, they are all bonded. That is on the assurance. And we have.
But you told us there are 2 or 4 who are bonded, but they left.
Like the one who went to KDF, as we alluded.
They left, and you say.
The one who went to KDF specifically was a specialist in
psychiatry.
And now you don't have a psychiatrist, and you let that one go to KDF.
Actually, through Madam Chair, they made a request to transfer service, and it's by law that they are allowed to.
Honorable Chair, if they can transfer services, what are this thing called bonding for?
Yeah, they should come back and work for us.
Yes,
Yeah,
and if they can still make an application for transfer and there's nothing you can do about it, what is the importance of bonding them? If the bonding cannot hold water, if they can make an application they want to be transferred and there's nothing you can do, what is the bonding for?
Through Madam Chair, the bonding is actually to make them come and work for us.
But they don't come and stay.
Unfortunately, under Public Service Commission regulations, they are allowed to transfer service as long as it's a government institution.
And this is where the problem is. You've released all of them, but they will come back again and make the transfers. And when they're away, we are facing the challenges that we are facing. So we'll continue being in the same problem year in and year out. I don't know, Chair, I don't understand even those 3 that they went. Those people, I thought when they went, these are the services that we needed so much in our county. But now again, they went, they acquired the skill that we really needed as a county, and then they went. And then we released others again to go and acquire this skill that we don't have. And then they'll come back again and they will leave. So we'll be in the same circle. Can you give us a solution?
Honestly speaking, it needs some serious review, because we are actually carried by the Public Service Commission, who again is giving them this the same avenue again to transfer to other government institutions on a government transfer. It needs some serious review, honestly speaking.
What if we make BCRH a parastatal? What happens?
Yeah, they will be able to BCRH. That might be a solution.
That can be a solution. Okay.
Honorable Layango.
Madam Chair, it means we're just left under the mercies of God. Because do you surely have control over the movement of these doctors? Do you have any control?
Through Honorable Chair, yeah, we do. We do have control in terms of releasing and bonding them. The only challenge is when they now request for government to government transfer. That is where we have a challenge. But in terms of if they are
as this career progression assisted us here in Baringo.
Through Honorable Chair,
because if they come, they go. You told us now there is one doing masters in psychiatry.
Yes, yes.
And you've already, there was one who left. How can you tell us, or how can you prove to us that the same one, the psychiatrist, will still come back and work here in Baringo? No, we are losing, no, taxpayers' money belongs to the people of Baringo. And the services they are rendering, they are supposed to render to the people of Baringo. Now that you have released them, the DIRAC, the JIRAC, munaketi, munaachilia. Wakikuja, you have no control anymore. So, how, tutafanya namna gani?
Before you inform Honorable Sialo, I would want Daktari to give us an example of a doctor who we've released him, amesoma, amemaliza, akarudi akatufanyia kazi. Number 2, Waziri, I would want to know how Kangor also came to our county we read it we had an interview here. He was also on a secondment. What was he doing from where he came from, and what did he come to do here? Honorable Sialo, please
The
inform.
information I wanted to provide is that from what my colleague Aengwa said, from the calculation, the reason why I'm asking, all these medics who went on study leave, they've said each one of them on an average is earning 300,000. So 18 of them in a month, the money that the taxpayers' money that we are losing in a month in terms of salary is 5.4 million in a month. Now, that is on an average. And of course, I know there are medics who earn up to 500, 600,000. In a year, Madam Chair, we are losing 64,800,000. Now, for a period of, that study leave, if a doctor is on a study leave for 4 years, then we are losing 259,200,000, Madam Chair. And when these people are qualified, they don't come back. So, county government of Baringo and the people of Baringo are at a great loss. So, Madam Chair, we really have to do something as a committee. So, to ensure that at least we remove this embarrassment that is in the public and in this entire country. Thank you, Madam Chair.
On addition to what Honorable Shano has said, he has given us on an average the amount of money we are losing as a county. I want to ask Dr. Kangor and the doctors seated here, most of them are doctors of course, that do we really value the value of money that we are using on these people? Do we care about the value of money? We are spending a lot of money to somebody to gain knowledge to come and assist us. But on the way you say, there are some circumstances which are very difficult for us to control. If it happens that when the government knows you have already spent money to this person, you have given him the knowledge they want, the skills they want, they will continue poaching from you if you don't have modalities as the county government of Baringo to ensure that such a doctors, we are not losing such a doctors in our facility. We have other counties, example of other counties like Marakwet and Eldoret and others. And of course, we are aware on how they are doing. But for Baringo, it is a loose kind of procedure that even today, if I become a doctor, I wake up tomorrow, I write my application to you, I'm granted, I go to Uganda, study there, take 4 years, come back again, go to Nairobi for greener pastures. What is the value of money? And my question is, Madam Chair, I have never been responded to. I'm still waiting. And I'm still patient. Thank you.
Oziri, proceed.
The issue of Chepcheng, I don't know. She's supposed to answer, the CEO. Maybe I can answer.
Allow me to answer on the...
Kangor, proceed.
Through Madam Chair, allow me to answer on the doctors who have gone to school and have actually given us the value of our investment or our money. 8 doctors reported back. One is 2 are pharmacists. The other one is our surgeon at PCRH. Our 2 radiologists. Our only physician. Our only ENT surgeon. Our only ophthalmologist. They went to school, came back, and they're actually offering services in our facility. Going forward to address that supposed loss in terms of them reporting back and actually disappearing. 1, we need to have a collective approach in terms of approaching Public Service Commission so that as Baringo, as a county, we get value for our investment for those who want to transfer service to a government institution. But again, there is room. Once we have all these specialists back, we can have what you call collegiate approach to training, where we have our county referral store, Ledam Ravine, as a training institution for specialists through the collegiate approach like OSEXA and the others, so that we retain the same doctor within the same facility, offering services but not specializing. And him upon completion of studies, getting his certification and actually being recognized as a specialist. So there's a solution to that going forward.
There's a solution from today's meeting, from today, that you've raised concern that now you can find a solution.
Yes, we can approach, there's a delicate approach compared to the university
What have you been doing to do that?
The only challenge is the number of specialists whom we have, but once these doctors report back, we'll have enough ground to request for the delicate approach to specialization.
But remember, Kangor, Dr. Lexin and Dr. Said left. You watching. The rest will still come and they'll still live through Chirag, through you, through the rest of you. When are you going to qualify? Number two, I still want Waziri to tell us how you came to our county on such a secondment so that we can get to know what kind of Baringo we are. If indeed you came with something that really helped us, or it is the same stories.
Okay, so that we don't mix issues, there was one question that needs to be answered.
I want you to answer the question of Kangor first,
okay,
so that Madam CEO takes up the next question.
Okay, for Dr. Kangor came to this county by self-request, and we followed all the procedures. And when we applied, Dr. Kangor was working in Nandi. He has worked as a director. He has even acted as a chief officer. So we felt that after his application, he was coming to add value at the level of management of our county, at the leadership level. So he followed all the procedures, and we accepted.
Did you have a substantive medical director on that, the position he was taking?
The director, medical services, you know, this is it's a very long story, because even when you invited us here, part of your invite was to investigate any employment malpractices and breach of any applicable human resource laws. And we have a director of medical services where we found the mode of engagement was a bit flawed.
Proceed, Waziri.
We found a director of medical services does not only play administrative role. This is a technical advisor to the county and the governor on matters of medical services, and their qualifications for it. And we are being guided by the Health Act 2017. And there is also an advertisement that was
which act is that?
27, an Health Act of 2017. And there was an advertisement that was placed sometimes in 2018. And when you look at the requirements, one is that one must be a Kenyan citizen. The other one is one should possess a degree in a relevant technical area, that is medicine stroke public health. Should have served at the level of deputy director for at least 3 years in public service or equivalent in other sectors. Demonstrate professional competence and managerial capability in health sector. Must be in possession of master's in degree in public health or medicine. he must have a certificate in senior leadership development program or its equivalent, and must be registered with the relevant professional body. Must be a computer literate and must satisfy the requirement of Chapter 6 of the Constitution.
Honorable Siala.
Thank you, Madam Chair. I wanted to interject a bit. Dr. Sirma, so does he meet all those qualifications?
Yes, he does.
So we have no problem with his...
Yes, he meets, he meets all that.
Now, do you know that there was a budget implication that was caused by his proposed secondment to Baringo County? Because we had a substantive director who was in that position and was earning salary, drawing salary from that position. And even if he was transferred elsewhere, that director or that person went with his salary the way it was, because there was no way you could demote him, and you had no reason to demote him or even remove him in that position, but only because someone is being brought to take over the position. So the director was there, was designated to a different duty, but he went with the salary of a director. Now a new director is coming in to replace him, yet we do not have a budget for that position. So where did we get money for his salary?
There was a budget, because I know there is a doctor who left in the same job group where he came to occupy, and that was even a specialist.
So can you prove
who resigned?
But
there was a surgeon. There are surgeon.
Okay, I agree. Yes.
Yes.
So can you prove?
Took over his salary.
Can you prove that there was a budget for his position?
You know, if there was no budget, the county public service...
No, simple, Sirma. I'm just asking. You say that you think...
Yes.
Just be sure of what you are saying.
Yes.
So, I want you to prove to this committee that there was budget for his employment.
Yeah, there was.
Yeah, I agree. You've said we don't object, but kindly just prove to us that before he's coming to Baringo, there were correspondence between the department, you, and the finance or the treasury department, accepting that there are enough funds to cater for his salaries, because the one who was there went to a different position bearing the same salary. So if you provide that, then we have no problem. Madam Chair, thank you.
And before you proceed again, you've opened another Pandora box. That a surgeon leaves and you think that budget can pay Kangor. Why didn't you bring another surgeon? For that matter.
Madam Chair, Baringo County has been a challenge. It has not been attractive to get specialists. Because of, there are many other reasons.
But Waziri,
yes,
you know you're proving a point. You know you're on these social medias. How PCRH has been operating. You know even the names that have been branded. Don't you think you're proving people right? That we don't have the right people in this PCRH? Because you tell me a surgeon leaves and you think that budget can be given to a director to come and just work in that office. Now it's a surgeon who have left this county.
Madam Chair.
And Waziri, you know we had a lot of hope in you. You have a very good record from PGH, Nakuru. And when you came in, we knew PCRH will be a new PGH. But to this point, we are in a very bad books. Even our hospital, in your eyes, PCRH has been reduced to level 4. Wewe ukiona tu. And looking at what you are talking with Kangor, because I have not heard from the rest, there is no hope. That through this committee now, we are going to plan on how doctors are not living. And if this meeting would have not happened, what would have happened? Members. Honorable Ayango, proceed, but by the look of the things, continue, I'm going to give you a chance. But Waziri, by the look of the things, even the questions as we proceed, Gile ya Raila bado mabambano. Proceed, Aingo.
Thank you, Honorable Chair. I think surely we are not getting the answers as we deserve. Therefore, we have even decided to just forge ahead without answers. Nevertheless, I just want straight away to ask them. There was a time, there was an outcry in Baringo North where the sub-county hospital was reduced to level 2. I think the anomaly has been corrected. You will clarify for us. Number 2, our county referral hospital, which I am so much skeptical about the name referral, because I think it is a conveyor belt for Moi Teaching and Referral Hospital. Why was it reduced from level 5 to 4? My questions will come direct and I want straight answers. I will not go round. Answer, and I will proceed with others, please.
Proceed to answer.
Thank you, Honorable Chair. Thank you, Honorable Chair.
CEO, Madam CEO, please proceed.
Are you? Okay, thank you. Now, I have 2 questions to answer. We had the first one for Chief Ching, and the one that just came from Honorable Aingbo. Then I want to start from the one from Honorable Aingwa because it is shorter. Now, Kabartonjo Hospital, around December, January, we had some issues regarding which level it was. And it was alluded that it was reduced to level 2. Now, I just want to make it clear, and I think we corrected the issue. You can confirm, Honorable, that Kabartonjo Hospital was inspected and qualified for level 3. Now, during the transition to SHA, the mistake was with SHA. They still put into data Kabartonjo is level 2 when they were key in. So when the anomaly came, we still wrote letters to SHA and they were able to bring it to its correct level. So Kabartonjo is level 3. Now for the referral hospital of Kabarnet Referral Hospital, I think BCRH is level 4. It has never been level 5. It has been inspected and we are yet to qualify, or they are yet to qualify BCRH to be level 5. So BCRH has never been downgraded because it is been level 4 and awaiting to be approved for level 5.
Thank you for being clear.
Yes.
That it has never been level 5.
Yeah.
But the word that was moving around all along was level 5. Now that we are used to saying level 5, that's why we even call it referral. What efforts are you making to make sure it is taken or goes to level 5? So that we reduce these issues of all the time ambulances, sirens down the valley to Eldoret.
Okay, there are a lot of efforts.
And time limit.
Yes. For it to be level 5, as I have just said, that they came, they have assessed it to qualify to level 5. Now, it has not yet qualified because there are some few requirements that we are supposed to meet before we make it level 5.
Which are the requirements that we are missing?
Like now, there are some services that is supposed to be offered. we have a number of nurses that are supposed to be, they have numbers according to departments, like how many doctors, how many clinical officers, how many nurses.
Have you raised the intent?
The intent of the total number of nurses
Yes.
that is required?
Yes.
The intent as we are raising it bit by bit because of finance.
CEO, that is a big lie. You said you're in the process of making this hospital qualify to level 5. And these things, we got it from our fact finding. We even didn't know how is it. The MedSup told us the reason why we are not at level 5 is because of the number of nurses, number of doctors, number of. Have you raised that intent to even the CS in preparation to that level 5, or even to the cabinet secretary?
Yeah, we already have an intent. We have an intent of working towards that. Like in the new, we have an intent that is with board, and we are awaiting shortlisting interviews, and
Please provide that intent to this committee.
it can be provided. I don't have it with me here, but it can be provided.
It was when?
It was early January or December.
Waziri want to give an input to that point. Please proceed, Waziri.
The facility actually was assessed by the Kenya Medical Practitioners and Dentists Board together with the MedSup, and the MedSup has the list of the requirements in order for BCRA to become a level 5. He has it with him. And the good news is I was called some 3 weeks ago by the health advisor of the President's State House, and he requested us whether was asking about whether there was a budget, and there was a budget. Otherwise, the county public service would not have accepted than what transfer to the county if there was no.
Why was it not competitive if the budget was there?
We had requested for, I told you we wanted a manager.
Yes. Why was it not competitive?
When somebody requests for transfer of service, it happens anyway. Even like the specialist.
But not in his position. Not in his position. That position should have been a competitive bidding. Is it true or lie? At his level, is it not a competitive position?
This was a request by him to transfer
Why did you accept?
Because we knew he has been a manager and he was going to assist.
And he had a manager already who was working.
But
Or you want to say he was not a professional?
There are issues that I had already mentioned.
You know, Waziri, how you can see the transition of Kangor by Jepching, the mysterious issues that are happening in Jepching's life. It was actually caused by him. He will not tell us, but I can tell you, we've done our own fact finding. How Jepching landed there, how he went to Uganda, now you are recalling him back.
I don't know whether you read the qualification of Mr. Chepching.
Don't tell me about the qualification.
Yes.
Now, that is the reason whoever employed Dr. Chepching to that position, was he not aware? Is it not a public service board in our county? Or is another public service board that did that job? You know, you want to check mistakes now, we want to go to the public service board. They employed Dr. Chepching. Is it true or false?
They did, but it was a malpractice. They didn't follow the advertisement.
And why did you take Dr. Chepching under the same salary to another hospital as a medso?
Yes.
Does he even qualify to be a medso?
As an administration, yes, you can. Administratively, and you can.
As a medical soup?
Yes, you can.
Waziri, take charge. Members proceed. Honorable Sharon? Honorable Lango, you want to ask something?
No, I'm proceeding, Honorable Chair. I'm proceeding. I don't know, Madam CEO, is Kabartonjo theatre operational? And we have doctors there.
Through the chair, Kabartonjo.
It's not operational because we still do not have enough equipments or all the required equipments to operationalize Kabartonjo theatre.
And we have doctors there?
Yes, we have. We have the medsup as a doctor.
Now, what happens? Until when will the theatre Kabartonjo be operational?
We have...
And I know one time Governor Kiptis went there and opened the theatre. This theatre will remain closed until when?
Thank you. I think we've had a discussion around it, and even the governor is aware of this, and he has given us instructions that by the end of this year, that is December, Kabartonjo Theatre should have been operationalized. And now, why it has not done so is because the budget, money has not been provided in the budget to buy the equipments that are required. But now, in our budget this financial year, we will factor it in. And even if it will not be in the budget, we are hopeful and very optimistic that now with the FIF money, we can set aside a certain amount. It's not much. We only need 3.5 million for Kabartonjo Theatre to be operational. So even using the FIF money, it is possible that by December, it will have operationalized.
So it is on record, Madam Chair,
yes,
that by December this year, Kabartonjo Theatre should be operational as per the Chief Officer. Nevertheless, let me continue, Madam Chair.
President Honorable
that we are now come to PCRH here, that in most cases we have transfer of personnel, clinical officers, nurses, doctors, without the knowledge of the medsup. Is that true?
transfer of staff to other places without a knowledge of MEDSUP?
Yes. And is he supposed to be consulted? Is he supposed to be consulted for that matter?
When we are transferring?
Yes.
When we are doing transfers, we sit down, and that is now between the chief officers, our CEC, and the two directors. And on need basis and on assessment that on a certain area, we could be having more staff, and even not more staff. There could be a very needy hospital somewhere that does not have even one staff. So we do transfer and then notify the MEDSUP through the copy that we have made a transfer.
So the law does not qualify that he be consulted?
Yeah.
Now, what about in such a case in like referral? I know in that areas you can move them around in level 2 hospitals and the rest. But in such a case, don't you think it is unfair that we have shortage of staff and you continue without maybe, if there is good relationship or so, could you maybe, after even making that proposal, even if the law does not allow, don't you think it was prudent that you could just inform him that we are taking this number of staff, we are replacing with these ones?
But most of the staff that we have transferred out of BCRH, they have been interchanged with other staff. However, Honorable, through the chair, sometimes if we try to negotiate in every hospital with the in-charges, none will be willing to release even a staff.
Now, another question is that it is alleged that the transfers have been discriminatory. Is that true?
It's not true, to the best of my knowledge.
Now, there is also a growing concern. We are in this hospital here because this is where all the patients in level 2 and 3, they end up here. And from here to where? To Eldoret. And we've been a laughing stock, especially along Iten Eldoret Road. Wherever they see an ambulance, probability for it being for Baringo is more than 50%. Now, and we are at the farthest. I want to ask, we've got some knowledge that most of the nurses or clinical officers who are having issues, maybe drunkards or have disciplinary issues, they end up being brought here for maybe closer monitoring and the rest. Do you think it is fair that you bring them, people under disciplinary cases here, even if it is for close monitoring?
Thank you, Honorable Member, through the chair. Now, I want to start with the referrals. And I want to confirm in this session that referrals outside BCRH has drastically reduced. It has sincerely reduced. I have received 2 phone calls from MTRH Eldoret. And the phone call was saying, thank you, BCRH, for the numbers have reduced. I don't know if it is true, but it tells me that from 4 to 5 per day to 1 per week. That is a phone call from MTRH. But even from the records in the hospital, it is true. The referrals are seriously, and we appreciate the reduction. Now, on the transfer of drunkards to the county hospital. Now, when I came in, and I don't want to take credit on this is something that I just said through management, and I said, I think all of them minus the doctor and admin, and I said that any staff, wherever they are, they will remain where they are. And if there is anyone who has an issue like a drunkard, we should not transfer a problem from one person to the other. And I said that we will try to rectify, and when they have improved or fully improved, then we can consider maybe transferring. So the issue of transferring somebody from one place to another, I think it is not there. Thank you. I still have the question to answer, Madam Chair. Should I?
Proceed, Madam Chair.
Okay. Now, there was this question that was asked earlier about the release of Chepcheng to Kampala University. Now, I want to maybe give us the steps that we follow before releasing someone to go to either outside the country or even within the country or to any college. Now, when a staff shows interest, any staff shows interest that they want to pursue or to go to school, then this interest is presented to DIRAC committee. Now that is the committee human resource within our office. Then this DIRAC will sit down and then will analyze the need, the request vis-a-vis the need. If it is needful that that staff goes to school, then it is approved in Chirac and then it is forwarded to DIRAC. Now, if DIRAC also ratifies, if it ratifies, then the CS will now write a release to these staff to go to school. Now, that is if the school is within Kenya. But if the school is outside Kenya, then now the CS will write, when it is ratified now through the stages, then the CS will have to write a letter to PS Health, no devolution, and then if it is approved, then now PS Health will write a letter to CS to approve the release of the staff. So that is how it's supposed to be done. But now for the case of Chepcheng, I was informed, it is confirmed, that the process was not followed. He was given a release letter to go to Mbarara University. Yes. And then later on,
the letter was by who?
Huh?
The letter that was given.
Sorry?
The letter was addressed by who? The letter that Shari got.
It was, I've not seen the letter, but I'm told the letter was addressed by the chief officer by then. Yes. So when it came to Chirac, and Chirac refused, did not approve. If it did not approve, now I was in that Chirac, by then I was in the Department of Lands, so it was not approved. So when it was approved, then Chirac recommended that Chepcheng be recalled. Now, so when I was posted to the Department of Health, that is when now I met the Chirac deliberations, and I had to recall Chepcheng from Mbarara University. So he was to come by April, but then he called me and he said, I put the letter on WhatsApp and I sent it to him in Mbarara to come back. But then he called and he said, please, I am about to do my exams. Can you allow me to complete this here? Then I said, this is now on humanitarian ground, I allowed him to finish. He has reported back from Kampala. He came last week and he came to the office. Thank you.
I've seen Honorable Lekekmon. Mike, please proceed.
Chair, I think I will continue to my questions.
No, it's not a... If it's the question, I think we can still wait a bit, Honorable Lucales.
Thank you. Madam Chair, I want to take Dr. back to the question Aengwa asked about Baringo being level 5 downgraded to level 4. I'm interested in that question, and I want to take you, Madam Chair, to Baringo County website, baringo.go.ke/health department. Baringo County Department of Health Service is headed by the County Executive Committee member, Dr. Solomon Sirma, is the one here, and two chief officers, Dr. Winnie Bore, who leads medical services, replaced by Dr. Ria, and Mr. Evans Ruto, who spearheads public health. It is made up of 3 sections that include planning, administrative, preventive, promotive health, and medical services. I'm interested in the last part, achievements. Madam Chair, I want us to go together. In order to reduce on referral cases to hospitals in either Nakuru or Eldoret, Baringo County Referral Hospital, Kabarnet, has over time, under the leadership of His Excellency Governor Benjamin Cheboy, EBS, been improved in terms of service delivery, particularly specialist services, so as to enable it to become the preferred medical service provider in the region. These high-end services include renal units, radiology, mammography, CT scan, intensive care unit, and high dependency unit for neonates. From 2013, more than 47 dispensaries were built and 13 other similar facilities upgraded to health centers across the county. These are achievements, Madam Chair. The sub-county hospitals were elevated to level 4 referral hospital, while Baringo County Referral Hospital was promoted to the level 5 hospital. That is not my words, Chair. This is from the website of Baringo County government. I have just taken some part and I have shown them where it is. Can they confirm if Baringo is in level 4 or level 5? That's my question. Thank you.
Kabarnet is still a level 4 hospital. The people, there is something called categorization of facilities. And who does the categorization is Kenya Medical Practitioners and Dentists Council, where they come with officers of various cadres and they pick 2 officers that have been appointed in this country to assess a facility, and they categorize it according to the standard of that facility. And the latest, I don't think it's even a year ago, they came to BCRH and I said there are requirements that are needed, and they give us the list in order for BCRH to be a level 5.
Proceed, Honorable Lucales.
Now that Dr. Sirma, you are saying that recently this facility was assessed by whatever body this facility. I want to ask, the information we have in our website is read by the people of Baringo and outside Baringo. So do you want to agree that the information we are reading from the website is misleading? Kindly confirm.
I don't know. You know, when before
and these are achievements,
people had assumed that it is a level 5 without
people of Baringo?
The people of Baringo. The people of Baringo.
But the website is not written by the people of Baringo.
Thank you, Chair. That's the question.
Yes.
Who is writing this website of Baringo? Who is updating? Department by department, because I've gone to Department of Health and I've given, including your name is there as a CEC in charge. Not this one issue done by Kiptis previous government. This is your regime, Cheboy 2 regime, and it is indicated the achievements you have achieved. Moving level 2 hospitals in sub-counties to level 3 and level 4, moving Kabarnet to level 5. And you are denying, saying we are still under assessment.
We are not under. It has already been assessed. People assume that we are level 5, but after the assessment, they found that BCRH is still at level 4.
So including those updating the government website are showing.
I think that needs to be corrected.
Do you know, if now we search, and I'll tell you, search Governor Cheboy speech of last year. It was in his speech saying Kabarnet has been moved from level 4 to level 5. It was updated in the website, and still you are still denying that we are not there. Who is misleading Baringo? Is Governor Cheboy misleading Baringo or Dr. Solomon Sirma misleading Baringo?
Me personally, I've never said that BCRH is a level 5 hospital, and I've never told even the governor.
Chair, I think we need clarity of this before we wind up on this one. It is an evidence based. I have not brought this issue from nowhere. Honorable Ayengo asked us one of his questions. It was answered that there is nothing like that. Still, the doctor says there is nothing like that. It is in our achievement of Baringo that Baringo River Hospital is level 5. Achievement. And these are good achievement. These are very good achievement. Why are we denying? Who is misleading who?
That should have been an error.
Dr. Sirma and the two CEOs, are you aware of the website and the achievement of our Excellency Governor Cheboy? Before even then, I would want to know if they are aware of the update. And again, if you are aware that the governor read a speech that Baringo PCRH has been upgraded to level 5. Starting from you, Waziri, the mic is on, then to CEO Ruto, then to CEO.
The other achievements we have achieved.
I'm just asking about the level 5. Don't mix things. Are you aware of the update in our website?
It was.
And now, the other levels, is it now as per what is in the website or what you know?
The other levels I'm aware. So that they are level 4.
So level 5, PCRH, you are not aware? And the website, you are not aware of the updated website?
Well, as I told you, the people who did the update, I don't think it came
Was it
from
which
my
people?
office.
The people of Baringo or the government? The government of Baringo?
No, the people usually update is not even that. It is the communication team.
From the Baringo County government?
Yes, yeah.
CEO Ruto.
Thank you.
Yeah.
You are not on record.
Honorable Chair, I'm not aware.
CEO Ruto, but you are aware that Baringo level, PCRH is at level 4, not 5?
Yes, Chair.
Madam CEO.
I have read
it on website, it is level 5, but it is not a fact. BCRH is level 4.
At least you have some honest in it, because honestly, you know, we are conversing, representing the people of Baringo. This committee represents the people of Baringo because they were elected to do this. But looking at the things in our health department, it's not going in the right direction. Honorable Sialo, Honorable Locales, then Honorable Sharon.
Thank you, Madam Chair. On the issue of Dr. Chep, what do you call him? Chepchieng, yes. You said he was released irregularly and you've recalled him back. So after how long? After 1 year, 2 years?
He has completed the first year.
First year.
Yeah, so that is 1 year.
So what will happen with the studies and the investment that he had made?
Now,
because there was an illegality?
Yes.
It was not approved through Chirac.
Yes.
It was an individual's decision to send him on study leave. And there is an official documentation for that matter.
Yes.
So now, what will happen to his investment?
Now, I have talked to them personally. He came to the office. The investment of going to school, he has to make a choice. Because now, the human resource policy will not grant him permission to proceed unless.
Yes, madam. Okay,
Unless,
I agree. There's no problem with that.
Okay.
My question is, someone who is an officer, government officer, authorized him. Because why not for Dr. Winnie Bore to grant him that permission to go for study leave? He wouldn't have spent such amount of money studying for 1 year, and then he's been called back. So that investment, are you going to facilitate back? Are you going to pay him back the money that he incurred studying for 1 year? Because you cost him as a department to go for study leave.
As an individual, I say no. And also, the ministry cannot refund.
Okay, what will happen if
it was an anomaly?
What will happen if it takes Baringo County to court? Are we not going to lose a lot of money, taxpayers' money, for an illegality that someone committed knowingly?
That is true.
Okay, Madam Chair, I've just received a concern through a text from a resident of Eldama Ravine. I think he had spoke about the medics who've gone for study leave. And this person is saying that there was a medic who was in Eldama Ravine, who was released on study leave and went abroad. And in the process, I think the arrangement was local arrangement. And in the process, he arranged with his brother, who is also a medic somewhere else, I don't know, in Eldoret or somewhere, to come and relieve him in Eldama Ravine Hospital. So the brother came to relieve, his brother was going to abroad on study leave, and the supervisor and the medsup, Eldama Ravine, allowed and permitted that to happen. Now, we're asking, is this doctor, okay, what is the name of this doctor who did that? Number 2, is he still in service? Is he still in study leave, or he has been suspended? Number 3, what disciplinary actions were taken against the medsup and the administrator of the hospital for allowing a stranger on a local arrangement to come and cover up for a person who is absconded duty or who is in study leave? That is a very serious issue, madam, that has been raised, that I think the department must clarify.
Waziri, proceed to tell us who is going to take that point.
Okay, Dr. Kangor.
Dr. Kangor, proceed.
Allow me to answer through Madam Chair. This is actually an anesthetist who left for the United States of America. Initially, as a study leave, but what was discovered later, he was actually moving away from Kenya. And he actually engaged a cousin of his to take up these roles because his cousin is an anesthetist. The case has actually been handled at Chirac, and actually they have been surcharged millions. Him and the perpetrators, that is the in charges of the facility. So it's a concluded case, and they have confirmed the county.
Allow me to
Honorable Siolo first.
Thank you, Madam Chair. So Dr. Kangor was saying they have been surcharged. Who in particular? Is it the officer who went abroad?
The immediate supervisor, that was the clinical officer in charge. And
what is his name?
She's called Rachel. The clinical officer in charge, that is Rachel. She's called Rachel. I can't remember the other name. And the anesthetist, that is Kurere.
Kurere.
They've been charged actually, yeah.
So the two also are surcharged?
Yeah, that's charged.
Okay. What about the med soup? The med soup and the administrator of the hospital? Because this officer came as a stranger and worked in a hospital, handled patients on behalf of his brother or cousin. And for what period of time did that officer stood for his brother?
It took almost a year.
1 year, a stranger walking without notice.
Actually, what confused even the management is that cousin was once a staff in the same facility. Yes, but they have been surcharged heavily.
So this staff who was covering up his brother or the cousin work on the same facility.
He was actually once a staff in the same facility, and that is why while he was there he could not be noticed.
Doctor, let's be realistic. If that person used to work for that facility and he left, and then all of a sudden he comes back and everybody accepts him back, but they know that the work he's coming to do was for his brother. And how did the two brothers found themselves working in the same facility? Those are the problems that we're facing in Bombay.
And as you answer those questions, how much was he surcharged, and has it been paid to our accounts? And if yes, we need those documents to be submitted.
And then finally, Madam Chief Officer is working out and had a question with, okay. It is confirmed that through our website, BCRH is a level 5 hospital. But now my question, Dr. Musa Sirma, Ruto, and CEO with the entire team. Under your leadership, our level 5 hospital, BCRH, is being reduced to a level 4 while you are seated comfortably. Sirma, will you even want to have that in your career?
Madam Chair, I think
you had concluded that point when Honorable Siolo was outside. I think we allow Kangor to finish the points that it was raised that was not answered before, so that we conclude on this matter.
Yeah, through Madam Chair, I promised to get details of what was those that was surcharged, and even specifically who was surcharged. I'll fill the documents.
When?
By tomorrow, because it's from the Secretary's office.
Tomorrow morning at around 10?
Yes.
It is. Honorable Lakakuman, please proceed with your questions.
Thank you, Madam Chair. My question goes to the CC Health, that kindly explain to this committee how the principal public health officer came to board and what is his qualification and experience. Principal public health officer. You have a public health officer, principal public health officer.
the Chief Officer Public Health.
CEO Ruto, proceed.
Thank you, Chair. Yes, we do have a principal public health officer, yes.
How did he come to board?
It is...
how did he come to board, that public health officer? What is his qualification and experience?
He's actually an outgoing... he's serving now on his terminal leave, because he has reached the requirements of 60 years. He has masters in public health. And how we came on board is that he's a member of our CHMT team, and there's normally promotions done after 3 years, and these officers are appraised, and if they are qualified, they get that promotion. And up to that level of principal public health officer, it is basically through the normal promotion. Immediately after that, the cadre just be above the principal public health officer is the assistant director of public health. Assistant director of public health normally should be competitive. It should be advertised, and people apply, they're shortlisted, and they're interviewed. And if they are found suitable, they can be given that position. Thank you, Honorable Chair.
What was his job group before you promote him to principal health officer? What was his job group, and how did he went to job group N immediately?
He didn't. Yes, it's true. The job group is job group N, but he did not. He didn't like jump to job group N. He just went through the normal succession plan.
How, you see what we were saying?
Let me interject a bit, Honorable Lakimon. Is there a public officer who was employed recently? Honorable CEO Ruto?
Honorable Chair, yes.
How did that happen?
The position was advertised. Yeah, there were, people applied. They were shortlisted through the County Public Service Board. They went for the interview, and yes, they were recruited for that position. It was actually one position. Thank you.
Which job group was that? CEO Ruto?
Honorable Chair, it was job group N.
And currently, what was he doing before he was employed?
I will not know what he was doing, Honorable Chair, just to be very honest. But I think the position was just competitive, and people applied for it. There are many other,
was he working in the hospital?
Honorable Chair, I might not have that information, and I want to go to the record. Yes,
Thank you. Honorable Lakimon?
Yeah, thank you, Chair. I think I will continue, because that was the issues we are following. How that principal health officer jumped from the group that he was to job group N. That was where we queried. And
actually, to make a point clear is that he was a casual worker?
He was a casual worker, and then he jumped to job group N, which is a very senior position, and we wondered how. Now let me continue, Madam Chair.
Sharon, you're seeking, okay, Honorable Sharon, proceed.
Thank you, Chair. When we did our fact-finding in the hospital, we were made to understand that this particular public officer was working as a casual worker, and actually was working, when he came, he was working under other public officers who are still and working as casual workers. There are about 4 in that particular hospital. And what really caught our attention is that the fact that they're still working as casual workers. And then we got somebody who was working under them and being trained by them, being given a very high job group N actually is at a level of a director. And if you could have used the same salary to even, that same salary could have confirmed these 4 public health officers that we do have. So this particular engagement is questionable in one way or the other. I don't understand how the CEC, who makes such requests, how did you make a request for employment of this particular person? Was it that we needed him so much, more than we do need these 4 others that have worked for so many years, 10 years, 5 many years as casual workers, and having one person who is earning a salary that can pay all this on those who are working in public health on permanent and pensionable basis, or even a good contract?
Proceed, Waziri.
I don't know whether you're talking of the same person that I'm guessing that. Is he called Ranguno? Yes, because I know a bit of...
Okay, and what you know is that that was one of the most recent recruitment that was done.
Yes. This officer, I don't think we even had control over it, because an advertisement was placed for that job group N, and he applied. Many others applied, and he was shortlisted.
My question is that, and even to seek clarity, this public health officer, is he somebody that we needed in our county more than we do need the 4 that are working as casual workers?
We're going by, I don't know, I think that the chief officer did the indent.
Did you raise the intent of the particular specific job?
Why? Yet we have these 4 who are working, they've been working over the years, and this is a totally new person. He came actually as a casual worker and worked for a few months. Just a few months. These other ones, they've been working for many, many years. And they went for the same interview. They applied, and they went for the interview, and they didn't get the job, but they took this other one that just came the other day. And considering the issue of casual workers, and you know who a casual worker is, these are people that we are mistreating, we are mishandling, and we are calling them casual workers, and they are not.
Ruto, proceed.
Thank you, Honorable Chair. The issue of raising an indent, it is informed by need. It is also very important that as it is, we appreciate the work that the 4 casuals are doing, but we also need people in management. It was informed by need. Honorable Chair, as we speak right now, we have an indent that is in the board that we require also public health officers, but at the entry level.
Proceed, Honorable Sharon. And on that note, we'd like to know, is the said who got the job is a graduate? Recent graduate?
Honorable Chair, yes, he has a degree in public health. And Honorable Chair, maybe also share.
And the experience, and the rest, the 4 of them?
I've not checked their qualification, Honorable Chair. Unless you want to give me time. Just to share.
That is where the problem is. The reason why we are having this, we are having these unending problems of casual workers is because of the heads of these departments. If you are in charge and you know those people are working in the office, you should know that we have public health officers who are working. You should know they are providing services to us. Then, as a responsible person, even when you are putting up your intention to employ such a person, you should say, but we have this pool of people who have been working over the years. I've checked their qualifications. You should know their qualifications. You should know the years of experience and say, I'm forwarding this list to the Public Service Board to have them considered. Because one of the things that we are really struggling with, Dr. Evans, is that we are having casual workers who can take us to court any time, and we'll end up paying millions of taxpayers' money on something that we could have regulated. And as a responsible person of that department, this is something that you could have seen, and we could have sorted out this problem if you had seen it in that angle.
Thank you, Honorable Chair. According to the County Government Act, the institution that is mandated to recruit is County Public Service Board.
Yes.
My role as the Chief Officer is only to recommend, and what I normally do to all our casuals, the people who are applying to seek any particular position, I normally advise them to come to the office and I do the recommendation to all of them. Now the process of choosing the suitable person is the is the County Public Service Board.
Just before we proceed, the other time the medical soup was here, he has been, if it's not the medical soup, probably the one in Mogotio, and I find Mogotio sub-county hospital to be quite effective. They've done letters over the years forwarding that these are the nurses that we have. While we understand, we all know that it's the role of the Public Service Board to employ, you also have a duty to inform them that we have these people who have been working as casual workers, contractors for over these years. They are qualified. And I'm really shocked that you have people who are working in your department and you don't really know their qualifications. And this is a call to you, and I don't expect, unless you have any other way you want to defend yourself, but this is a call to you and everyone else to be in charge of their department and to help us sort out this issue of casual workers and employment matters in Baringo. But as you speak, you are doing barely nothing on that.
Honorable Kakimon.
Thank you, Madam Chair. I think we have exhausted that part of the Principle of Public Health. Is in any way that officer related to one of the senior officers in the department? That's why you left 4 of them that were there, and then you that person is picked by Public Service Board to head that department. Is he related to any of you that there was some kind of discrimination and nepotism?
Honorable Chair, I think in that regard, I'll speak on myself. I'm not related in any way whatsoever to the particular officer. I don't know whether my colleagues can also exonerate themselves, but from my side, I'm not related. 2, I think the issue, if I can go back to the issue that Honorable Sharon said through the chair, we do have their qualifications, and most of these casuals, they are contracted by the board, the hospital board. So yes, we have that qualification. We have we can get the qualification. Thank you.
On that note, I would want to inform you that Honorable Sharon was saying, when such an advert happen, it takes you take leadership to inform the board about the people that are in office, their qualifications, and ask them if they can consider, so that next time the problem doesn't come to your desk that CEO Ruto, you are not even aware about your staff and the rest. I would see, Madam CEO, would you want to add something on that point?
Maybe add up on the question that Sharon just posed on what role we play in ensuring that the casuals are taken in, the professionals. Now, I want to say that we have a role. And like for my department, I have already prepared a list. I am calling it a wish list, and I have informed the board. And this is a long list, a wish list, that if it is well, we have these casuals who should be maybe given preference because they've stayed for a long time.
Please table that wish list to us.
Yeah, we shall.
Thank you, Honorable Lapingman. Proceed.
Yeah, thank you, Madam Chair. I just want to ask whether you know a staff by the name Florence Kibor. Florence Kibor, what is her role at Marigat Sub-County Hospital?
Angor, proceed.
Through Honorable Chair, she's one of our senior clinical officers who is in charge of the clinical services within that sub-county of Baringo South or Marigat sub-county. They usually interchange the two names.
So what is her role? Is a clinical officer?
Yeah, she's in charge of clinical services within that sub-county of the sub-county of Marigat or Baringo South sub-county.
Who is the head of TB program in Marigat?
He's called Kiplagat.
Huh?
Kiplagat, Benson Kiplagat.
Benson Kiplagat.
Yes.
Is the coordinator, is he the head of TB or the coordinator of TB programs?
He coordinates TB programs within the sub-county.
And have you followed his work as a coordinator?
Yes, we've followed up. And allow me to report to this house or committee that there's a report you're waiting from the TB program. I understand it's getting to our table where we have 2 pre-XDR cases in Marigat sub-county. What I mean is those who are almost becoming extra drug resistant to TB. And that epidemiologically means either the system has failed or somebody has failed in managing TB within that sub-county. Baringo County is one of the highest burden counties in terms of TB, and more so Baringo South sub-county. So if in case there are 2 cases of pre-XDR, we have to investigate and actually get a detailed report because it means a lot. This is a communicable disease. TB is a very bad disease, and we cannot take it lightly as a communicable disease.
Now, are you aware that this officer has not been coordinating TB programs in that county? And an information has been relayed that he has been doing some forgery of rubber stamps of all the TB sub-county hospitals. That's why you have the resistance, some people resisting for those drugs because he has not been visiting those facilities.
Yeah, through Madam Chair, in fact today in the morning when we were actually coming for this session, the TB coordinator, the county TB coordinator informed me that there's a report is falling to our table. Maybe after this session we'll go and review the report, and actually if need be we can forward the formal report on his conduct, especially on matters related to those cases of PXDR and even MDR cases within the sub-county.
Now, are you aware that this officer, same officer, has been drawing some tokens to give to those officers who are giving patients drugs? Is he drawing some tokens?
Allow me to respond administratively about the case through Madam Chair. TB program is actually coordinated by the National TB and Leprosy Department in the Ministry of Health. And through the county TB coordinators and a program called TIBU, they're able to run, it's actually a program on its own. And some of those tokens and even the allowances paid to conduct some activities are actually coordinated from nationally. What I'm aware, though I'm waiting for the final report from the coordinator, is there have been alleged cases of forgery, alleged case of them not doing the right thing. Like we have a program called DOTS, Direct Observed Therapy. That is where a healthcare worker, either a nurse or a public or a paid by CHP for that purpose, is engaged to make sure he gives that drug to that patient and confirms in records. Those allegations are there, and we are to go and verify from the report from the coordinator.
Yeah, because we are getting reports that this officer has been doing a lot of forgery in all the facilities. The people who are giving drugs to these patients in Kimalel and other stations, they are not getting their allowances because this officer has already his own people he has been using, and that's why we have high number of TB patients in Marigat, and that is where you have now some patients resisting the drugs because they have not been treated well. What happened that this officer you have transferred to another sub-county and you reinstate him back again? What happened?
Through Madam Chair, I think we've not reinstated anybody. It's a case, we're actually waiting for the report, official report from the coordinator for us to act. Otherwise, it's an investigation going on. I was being informed in the morning when we were coming for this session.
Yeah, because we want to see the kind of action taken for the forgery. This officer is forging. We want to get the action taken by the fake information he has been giving. We want to know why the people who have been giving drugs to these patients, they are not given their token. Somebody is having his own team, fake team, that does not even link with the patient himself. This is to say, this officer does not have an officer ahead of him to monitor what has been happening.
Through Madam Chair, that is well noted. We are waiting for the final report, which we can, if it's by request of this committee, will table through our Chief of Public Health.
So why do you bring another officer now, Florence, to go there to that department, and we have officers like Cheseren who has been in that department and doing good job, and then you bring another person knowing that there is something that is not good going on? Why did you bring an officer on top of officers that have been doing good job in that sub-county?
An additional question, Madam Chair.
Honorable Locales, proceed.
I want just to reinforce my colleague here that is Florence Kibor taken to that department in preparation of what is perceived as failure by the TB coordinator, and therefore Florence Kibor will automatically take the leadership of the coordination. Yet there were other officers who have been in that department and they were overrun by the coordinator, and therefore from your own end, the leadership, top leadership of the county, is there such a plan?
Honorable Legekman, have you finished?
Madam Chair, these are some of the anomalies. I'm surprised because I'm one of the members of the health committee, and these are some of the issues that has been happening in the hospitals and no action is being taken. In fact, when we talk of discrimination in this county, it is real. Because when you get somebody doing good job under as an officer, you tend to bring another officer on top from nowhere to supersede what those other small officers have been doing. And when this is a trend where an officer can forge rubber stamps of different facilities in this county, where does those drugs go? And this is an area that we need quality care to these people. TB patients need care.
And TB is a
it is a communicable disease. And when a patient who has been a TB became resistant to those drugs, then we have risked their life. And here is an officer drawing tokens. Here is an officer getting money, and he has made some fake and some forgeries, fake information, and is comfortable and no action taken. That is how we lose our people.
Otherwise, we are concerned about it.
See, Ruto, before we proceed as well, you tell us who Florence Kibor is, what does she do, so that you give us your input. Honorable Sharon, on the same case, okay, proceed before before CEO Ruto answers the questions.
Also, I want to be informed who does these transfers and what makes somebody to be transferred. Do you wake up one day and feel like this person is not suited for this particular place, and then you just wake up and transfer? Because we've had cases of whereby the CEC wakes up and together with the director here and they transfer people anyhowly. So we really need to know what are the processes of transferring people.
CEO Ruto, proceed.
Thank you, Chair. I will start with the issues raised by Honorable Lekakimon. The allegation.
I would like you to give us the information, if you know, about the Florence Kibor first. What does she do at the moment before she was sent to that department, so that you proceed on the next points. CEO Ruto.
Thank you, Honorable Chair. Florence Kibor is one of our senior clinical officers based in Marigat. Initially, she was our county TB coordinator before being transferred to Marigat. The reason as to why, Honorable Chair, I wanted to start with the issues raised by Honorable Lekakimon, it is because the issues are intertwined with the allegations raised. The issue of the officer Benson, I got these allegations last week about the malpractice that this particular officer, about that particular officer. Honorable Chair, the issues are so serious that we had to take a stand action. I have already instituted a team to investigate within the county, so that in the principle of fair hearing and according that particular officer also a fair chance to defend as himself, I've talked to the sub-county coordinator, Mr. Tutoek, and some of the officers to investigate the allegations, so that when we make a decision as a department, we make a decision that is informed by the facts. As we also wait the report from the national office, the Department of TB and Leprosy, we also wanted to do our fact finding as a department before we discipline that officer. Honorable Chair, that investigation is still on, and we will have a session tomorrow in the morning as the health leadership to interrogate the allegations and also make a decision about that particular officer on the issues of the malpractice. The issue of Florence, we wanted Florence to be like sort of meanwhile, because we cannot leave that department. TB is a serious disease, Honorable Chair, and we need someone to be, we cannot leave that office vacant like that.
Are there other people who are working with Nelson?
Honorable Chair, Benson, not Nelson.
Okay,
yes, Benson, yes.
Are there other employees who are working with Benson? Allow him, Honorable Lekakimon, to give you answers.
And another officer is brought in, and the officers who have been assisting in the department. So I don't know, unless
What makes Florence
more.
Thank you, Chair. And the reason as to I just mentioned that Florence was our former county TB coordinator, so she has the expertise.
Yes, former, but now she works as who?
She's the clinical officer in Marigat.
Why do you remove? Yet we were in Marigat, and
Yes.
they are complaining of you people pulling out staff from Marigat to other departments, and they don't have doctors. Honorable Sharon, then you proceed to answer those questions.
Chair, I also want to understand, now that we have other people working with this, with Nelson, who is about to face some disciplinary action. There are other people who are working with him, like Cheserem, for example. What makes Florence more special than the rest? Are you, if you do that, are you now not promoting the discrimination that our public service people are facing in Baringo? This discrimination of people knowing who is who, and then they get favors over the others. Are you not going to promote that? And if that is the case, are you willing to rectify the issue, take Florence where she was, and have another person in that particular pool of people who are qualified and they've been doing the same job, given that job?
CEO Ruto, proceed. Okay, Honorable Lango.
A quick one, for motivation purpose. If people have been working and you bring somebody else, yet there is another qualified person there, don't you think you are demotivating those who have been there?
CEO Ruto.
Thank you, Honorable Chair. I want to go on record by saying that Florence Kibor is not special. Yes, I just want to go on record, and the reason as to why Florence was given that position, it is because she's qualified. She's better qualified than the rest of the team, like Cheserem and the other team. And Honorable Chair, the decision to select a particular officer to any office, not only the TB office, it is an informed decision formed by myself, the CEC, my colleague chief officer, and the directors. We normally have these meetings and have a discussion. It is not a responsibility of only myself. It is something that we need to sit as a department and make that decision.
But CEO Ruto, you want to tell us the people that were working under that Department of TB, the person who was following Nelson on that, because they work in an hierarchy. When you have like a deputy, the people who are working below Benson are not qualified. CEO. And again, before you proceed, I want, when was Florence Kibor seconded?
Last week.
Do you have the minutes for the same?
Sorry?
You have minutes to show the same, or is by verbal?
We didn't have minutes. We normally don't have minutes. We just have, a daily routine meetings.
Ruto, even in Cheshire town, there's nobody who is being given a responsibility in an organization by word of mouth. That is a CEO who works in an hospital. You just recall her, unamwambia aende tu.
Honorable Chair,
Daktari, you are a professional.
We don't just call people, we write letters.
Yes, and they should be minutes, because you said you sit. There is no letter that comes from one person. If you sit, it means it's a minute.
It's actually signed by myself and my colleague Nancy.
On that note, Madam CEO, confirm to this committee that the people who are working under Benson are not qualified to take that position.
I do not know their qualifications, but normally when giving promotions, we give depending on the job group.
Madam CEO, remember, this is not a promotion.
Yes.
This is somebody who've done a mistake and we just want to step aside as you investigate first. So in that process, what happens? You know what you are saying in black and white. There's favorism to Florence Kibor. And we want justice for the people who are working under Benson.
Okay.
Because I'm sure they know what's supposed to be done in that department. And now you've stated clearly that you're going to investigate on Benson. It's not clear whether atakuwa kwa makosa. So if you want to tell me you're bringing Florence Kibor because she's an expert of what? But she's a CEO in Marigat, and Marigat already are complaining that they don't have the doctors, the CEOs. So if you remove Florence Kibor, who takes up after her?
Honorable Chair, this is just an added responsibility. We are not taking Florence from the, she will still continue to see patients. This is just an additional responsibility. And two, it is true that there are other officers working with Benson, like Cheserem and the rest. When you look at the qualification of Florence, Florence is better, she's better qualified in terms of experience.
You see, you're actually becoming a conduit of these casuals. Because why we are here is because of these casuals. When they are at the point that they are going to get an opportunity, you come up with your own regulations. But when they were working with Nelson, they were very okay. They were working under that TB department, they were very okay. Until when this opportunity comes in, now you want to come in with your person that you want to take them to that department. We are aware of the things that are there in that department. Please regularize, Waziri, take up that responsibility, give people responsibilities. The person who, Kina Cheserem have not been given that responsibility, wakashinda, so that you say, if we give Cheserem this job, he will not do it. But you want to remove somebody who is working comfortably, is working with the patients in Marigat, you want now to remove them and take them to another department. Then what happened to that position? Please, Waziri, and these people are not saying it in black and white. Let me tell you in black and white. There is favorism to Florence Kibor, and please take up the responsibility. I've made a ruling. Let's rest at there, Sharon. Okay, proceed before I make the ruling.
Okay, Chair, now that Evans understands the qualifications of everybody in that, those who are working under that department, these people, how many are they that are working in the tuberculosis control? I don't know the name, but how many people are working in that department together with the person who is going to face the charges?
CEO Ruto. Thank you, Honorable Chair. These officers work together.
I'm asking how many, please allow, just answer my question so that we move very fast.
Chair, I think I'm trying to answer the question.
How many staff are in that? Kangor is over there.
There are 7 officers.
There are 7 officers. So you're saying among all these 7 officers, Florence is the one that is more qualified than the 7. That is what you're saying? Yes. Okay, what are the qualifications that you're looking at when you're putting Florence against the rest?
Someone who has experience in epidemiology, and also someone who has worked in TB.
So none of them has experience apart from Florence, you're saying?
Honorable Chair, I said all of them have experience, but in terms of the best suitable candidate was Florence, according to our...
I'm asking what made her stand above the rest? What made her more palatable and look like someone who is more qualified than the rest? If they all hold the same qualifications.
CEO Milka, if you have answers, stop whispering. You allow CEO Ruto to give us answers, or you pick the mic and give us the answers.
Thank you, Honorable Chair. It is because of the experience that she has in TB.
How many years experience does she have?
She has served, Honorable Chair, initially as the county TB coordinator.
How many years of experience does she have?
In terms of...
If somebody who is managing TB in our county, how many years?
I need to confirm the years.
You don't need to confirm because you seem to know this area so much. You are the one who said that she's more qualified. So if she is more qualified than the rest, then you know the information. And if you don't know, we'll go back to where you started lying to us.
Honorable Chair, it's true, I know.
How many years of experience?
Because myself, I'm an epidemiologist.
Okay, how many years of experience does Florence have?
Honorable Chair, I need to confirm that.
Okay, how many does the rest have?
Still, Honorable Chair, I need to confirm that.
Chair, that information will need to be provided for in this house in terms of the experience
and why experience and the minutes. And when you're drafting the minutes, this is not a decision that can be made by you, because this is where abuse of office will come in. And remember, Evans, don't answer these questions as a way of evading or trying to cover up anything. These proceedings are being followed by EACC, and this is where abuse of power can come in, office can come in. And if you're trying to cover up anybody, that is where you'll be caught in a mistake that you are not even part of. Or maybe you're part of, who knows if you're part of it or not. But Chair, I would really want to see the information today, because we're going to make recommendations on the same. Before we table that.
Confirm to this house that you're giving the qualification of that job, the level of for Florence Kibor and the 7 of them, that allows you that you perceive that Florence is more qualified than the rest.
Thank you, Honorable Chair. That is well noted. I will provide the information of the 7 officers in terms of the experience and the qualification to this Honorable House by close of business today. Thank you.
Thank you, Sir Ruto. We allow Honorable Moti to take up his questions.
Okay, thank you. I think my question is more of finance and procurement, not medical, but I still think MedSup will assist us here, or any other person who can take this one. We are all aware that in every institution, procurement, accounts, and HR are the most important departments in an institution. And my question is, do we have an hospital accountant in PCR? Do we?
MedSup.
Madam Chair Lady, we have a hospital accountant by the name Kevin Kimaru.
Okay. Human resource?
In human resource, we have a staff by the name Dorcas Kurui.
Procurement officer?
Procurement, we have Kilinyo Ruben.
What are the terms of the accountant? Permanent, contractual, or casual?
His posting is from the county. It has a county letterhead. So he is not on hospital contract. Kilinyo is on hospital contract, and Kilinyo is a subordinate, so it's permanent. And Dorcas is
who is the accountant?
Kevin Kimaru.
I'm talking about the accountant.
Yes.
Let's go slowly.
Yes.
Because some of us are slow learners.
Okay.
So who is the accountant?
He's Kevin Kimaru. He's an employee of the county government.
On permanent basis?
Yes.
You permanent? You are sure?
His letter came with a county letterhead, posted to a hospital.
No,
answerable.
that is fine.
Yes.
But he's on permanent, he came on permanent basis?
Yes, he is.
Okay. What about the human resource officer?
Human resource officer is on our hospital contract.
Overlooking or overseeing all those who are permanent and also those who are on contractual?
I need to explain a little bit.
Please do.
We had permanent staff doing the role of human resource officers in the hospital. They worked with the same Dorcas. And then when I came there, we had an Irene Kampala. She was permanent, she was transferred. Then there was another one called Memo. She was transferred. Then now we were left with the one who was working with them, because we couldn't get, and we did not get a transfer in of a human resource officer.
Okay.
Because our hospital has a lot of human resource functions to do.
Okay.
We had to do with what we had.
I think that one I will give you I5. But have you given any intent so that you want somebody maybe to be permanent basis or something like that?
The need for the hospital we always do, and I usually do once every year, usually at the beginning of the year.
So you have done for maybe to confirm the way you have sourced the Dorcas, to confirm even Dorcas.
Yeah, okay, she's included in the list that I usually
fine.
do.
Okay,
Yes.
that's okay. What about for procurement officer?
Procurement officer is a permanent staff.
Permanent?
Yes.
Okay, fine. Now, are you further aware that said officers are assigned sensitive assignments such as, I mean now the one for who is casual, but is not dealing with fuel?
Yes. Sorry?
You said they are...
Especially the BCRH. And I've been left to take care of them, especially overtime and even during working hours. What has he done as a soup? To ensure all hostel. As the superintendent I'm checking in and checking out of staff to minimize the hostel. I've staffed in terms of the nurses, the COs and the doctors. What is the required number? Also with the Chemolingot, where I'm told there are only 18 and doctors, and what to ensure that we have service delivery in all our. Aware of one Margaret Kangogo at our count of Margaret Kangogo. And lastly, maybe let me receive those. I have one last question.
Accountant, the human resource, the procurement officer, who are exactly in charge, and they want to see their job descriptions, whether they are casuals or.
Thank you, the Honorable Chair. About awareness of staff being absent from duty, I am not aware. What I know is that I have reports of staff who could be absent from duty for. I usually do 3 unannounced hospital events. I ensure who is present and who is not present. I compare with the duty rota. And then about how to manage this better. We as hospital management had planned to procure a biometric clock-in, clock-out system. In the process of doing that, we learned that the HMIS, the government is doing a project that will have all health management information systems countrywide to procure something, and then the national government does another one. So, in the event that this takes too long, especially from national government, we will proceed attendance register. The appointment letters of the accountant, the human resource officer, I should be able to provide that, but I may not promise that. I was supposed to attend a function in Western Kenya, so I may be away the rest absence. Thank you, Madam Chair Lady.
The government is planning to buy some biometric machines, which we are not certain. And if that machine is bought, and the county and the national supplies, you can even request them to, you have already installed. The more we delay in putting up this of absenteeism of staff, because some people, they are doing other issues outside there. They are serving their own clinics or doing their local playing from inside. You know, we had time with your people over last week. Folk or say anything. We're asking you from a point of information. And therefore, when I made soup, I'll want the don't even delay buying this machine. With the help of everybody else will come and improve Baringo. And I think it will be one of the parting shot that if you people don't improve Baringo, who else will come and improve Baringo? At this time, we have been given this opportunity to serve at the Baringo. And the people of Baringo are the Solomon. People are losing confidence. It has taken you long to get the people of Baringo happy for what you are doing. The responses, that's about Mersup, and I'm done with you. I'm done with that one. So the other questions, Madam Chair, to proceed. You asked.
Waziri, proceed to point whoever is.
The one based at BCRH. Actually, somebody called Chesar, who was the health accountant department in charge of accounting in the health department, but he sits at BCRH through a posting order from the office of the CS. There was one whose source in the department should belong to the of CHMT. About our qualifications, that
was done by HR, Director HR, the main HR for the county.
Who is the main HR for the county?
Rotich. That is his office, yeah, Rotich.
Okay.
Yes.
Noted.
Yeah, now, can I proceed to answer the question?
There is a gap left, and when the postings of staff within BCRH, inside or outside, that's my big question. Is it always done without your knowledge or with your knowledge?
Thank you, Chair. To Honorable Locales, sorry for the name.
Locales.
Pole. Now, we only have control over the professional staff, the medical staff, but the other staffs, it is taken up by the human resource.
So as a chief officer in charge,
yes,
what basically is your role, officer in charge?
Yes.
What basically is your role on issues? Not of the opinion of this committee, but my opinion. After observing, going around our health facilities, doing observation in those health facilities, there is still much to be done. Do you have anything to say about that?
According to me, I don't know whether you paid a visit when you were in Lema Ravine. The visit the MCs did at night.
I was not part of those who visited Lema Ravine.
Yeah.
That is a take-home, Waziri. We don't have to go back to those pinpointing. Honorable Locales have raised his points. It's a take-home points. Honorable Sharon, I don't know if you want to...
Not yet.
I wanted to know if Honorable Sharon want to make a comment over your issues or it's a new thing. Okay, please, CEO Ruto, proceed so that we go back to Honorable Sharon.
On our sub-county hospital and staffing.
Madam CEO, please proceed.
I'm the one in charge of the sub-county hospitals. That's why I'll take it up.
Thank you.
Not CEO Evans.
Okay.
So thank you. So you asked about the nurses, and I really want to appreciate that note, because the number of nurses that we are having in the sub-county hospitals are very few compared to the ratios required by WHO. Now, like for Chamalingot, where you have the interest, we have only 8 nurses.
Imagine.
It is 8, but it is supposed to be 20. When we come to the general picture about Baringo County is that we have 488 nurses to take care of all the 232 facilities. So it is true, we are having something I can call serious shortage of nurses. And it is really, if it is well, then I think all the arms should come together and look at this issue. Because in the very near future, like now in BCRH, when you check on the ones who will soon be exiting, the nurses, there are so many. And in the year 2030, we'll be having a serious one. So if we can come together, maybe shut down some projects and give a priority to the department and employ the nurses. We need over 2,000 nurses to man Baringo County. We have 488. This is a serious shortage. So Chamalingot, you have 8, but you require more than 20 nurses.
Honorable Locales.
Yeah, so that I may conclude on that question. Thank you, Madam CEO, for your honest response. Now that, let me dwell on issues of nurses. Let me not go on issues of doctors and CEOs. On issue of nurses, how many nurses have gone for retirement or even exited service recently? How many?
I do not have the record with me here, but with the number of the intern 17 that we gave for employment, we divided by 2. Then that will be around 6 or 7. Because for every senior nurse who retires, we replace it by 2. So if I will use that, I want to assume because I do not have the correct number. So we can say around 8. Yeah. Who will be exiting between December and this June. Now, between June and the coming December, we will have another number exiting.
So let's say those who you were intending to replace.
Yes.
Are already those who have exited
No,
up to June.
Yes.
Up to June.
Yes.
I'm in concurrence with you.
Yes.
So as now the department, what is your plan? Because those who have exited are few compared with the number that we are already below in terms of staffing. We are less. What is your plan as a department to have more nurses employed in Baringo? And through any way, through convincing the governor, through affirmative action, through whatever means, that convincing the treasury to have budget, just like the case of the ECD teachers recently. Have you thought of even using your committee, the committee on health, to take up this issue, because now it's becoming a county problem.
Yeah.
Understaffing of over 1,600 nurses. Understaffing, that is a serious issue. That's why we even say we need services in Baringo, and yet we have the major problem is staffing. We don't have the people to help us serve these people. That's why even we have a lot of number of casuals in our health facilities, in our level 4, level 3, and level 5, which we are still yet contesting. So I think there is, what is really your plan as a CEO and the Department of Health to have more number?
So, one is through replacements.
That's one.
Replacing those ones who are retiring. And then two is to appreciate the effort that this house has done. We have several number of honorable members in different wards who have set aside some amount of money to assist us, contract and pay some staff in those facilities. And the third one is that we have really spoken about mass recruitment. That's why I'm saying, if it is well that all of us, I mean, both arms of this government, to come together and put aside money, the way they did to the ECD teachers, the agriculture department, and, you know, health actually should be a basic need in our county. So if we can come together and forego some 1, 2, 3 and give priority to this, then we will be able to employ.
I think also you need to be very meticulous on this as a department to convince, use the power of convincing. I don't want us to dwell on that. Now let me finalize with my question on still issue of nurses. Why is it that when there was a last recruitment last year of around 8 or 9 nurses, the nurses who have been volunteering in our hospitals were left, and those who are just finishing from service were taken? Whose fault was this? Do you always recommend even those serving in those dispensaries? Like, and I can tell you, we have nurses who are volunteering without even a pay in some of our facilities like dispensaries. They are volunteer for 3 years, 4 years, but when employment comes through the Public Service Board, what is your advisory to Service Board? Because you bring somebody who has finished school 2 years, leaving somebody who has just volunteered for 5, 7, 8, 9, 10 years, either in Baringo Referral Hospital, either in Chemolingot, either in Ravine or Mogotio, or even a small dispensary at Saimosoi. Why is that happening?
Through the chair, this is sad. I want to accept it is sad that when we do employments, you know, others are taken, leaving out those ones who have been assisting in the hospitals. We have discussed it in Chirac, Chief Officer is here, and we have agreed, one thing that has been agreed upon, that in future adverts, it should actually mention the hospital.
Yes.
So that in that hospital, if there is a nurse who has been working there, they give priority to that nurse. So that is at least something that we have agreed in Chirac.
And,
then the other thing is...
And are you able to transmit that to the service board or county secretary?
The CS is the chair of Chirac, so he
Yes.
was there. He was in agreement with us. Now, the other thing is, this is what we've been saying, and I've said it personally in Chirac, that if it is okay, can we do an internal advert so that we take in those who have been, you know, in the system? But then the answer that I get sometimes is that when we do the internal advert, then we will find ourselves taking maybe nurses from the same region. And we need,
the regional balancing. And we said at some point that can we one time make that mistake once and for all so that we absorb and then now move on.
Okay, Madam Chair, I think I'm a bit satisfied with how far the department or the CEO have taken this issue to Chirac. But now the problem, my biggest problem is, will Service Board implement? And have you written, the Chirac, have they written to Service Board informing of this workable formula of mentioning if today I need a nurse at Kongor dispensary in a correct, the entire correct division, that we mention Kongor dispensary. And if there is somebody who has been volunteering in Kongor dispensary, we get somebody who has been volunteering being taken. Will the Service Board, in your own words, will the Service Board honor?
Madam
Times
CEO,
we work
proceed.
together. So when we give that advice, I'm expecting the board to accept. Because now there are places where even when you'd want to send someone, they don't want to go. So we want to adopt this. And working together means that we should come into agreement at some point. And so board should not have a problem. And if they will, then we will, I don't know, because we have not discussed it. So I cannot say if they will have a problem with them. But with Chirac, we are done.
Honorable Sialo.
Thank you, Madam Chair. I have about two short questions. Number one is to Waziri and Madam Nancy. There was a staff that was transferred from BCRH, the Department of Pharmacy, to Mogotio. And there's a complaint there in Mogotio that she has not reported for about 8 to 9 months. Are you aware of that case? And if you're aware, what have you done to solve it? Number two is about a concern that has been raised by the junior medics in the Department of Health, that on the issue of career development, you as the leadership in that department are biased. You're only considering those who are senior medics, doctors, for study leave. But then these other junior officers, the nurses, the clinical officers in various departments, are not considered for those career development courses. And again, they say that when there are these donor-funded trainings, you always consider yourselves at the top. You go for those trainings like for malaria, TB, and others. But then those who are actually doing the real job, who are actually supposed to get those trainings, the nurses at the dispensaries and the level 4 hospitals, are left behind. So that you go and draw the per diems, you enjoy, but the people who are doing the real work are left behind. Yet they are the people who are supposed to get the new trends of the diseases that are developing and probably how to handle such cases. So why is it that you consider the top for those per diems and those trainings, the donor-funded trainings, and then why is it that you only consider those senior medics for those career developments?
Waziri, proceed.
About the officer who is a pharmacist called Pauline, I know she was transferred from BCRH to Mogotio. What I know is that she had some medical condition that she needed attention of a doctor in Nairobi. That's the last time I knew about her. When she came back, she was given leave to be attended to by a psychiatrist in Nairobi. So I think who knows further about her absence.
Honorable Sialo.
Thank you, Madam. Just some more clarification. What was the reasons of transferring her to Mogotio? Was it on medical grounds or what was the reason? Was it because of some malpractice?
No, not for malpractice. One, was that we had promoted a pharmacist to be a med sup, so she was going to take that position. And also,
Is that true?
Kindly
Mr.
be on record, Waziri, pull down your mic.
Yes, I want you to be on record because
Yes.
we're asking what we know.
Yes.
We are informed. When we ask such things, Dr. we are very informed. Okay, proceed.
yeah, so she was going to take over from Dr. Wanaina with the med sup now in Mogotio Sub-County Hospital. And she was also transferred because she had requested that she want to be out of Cabernet from some social issues. I don't want to mention them. She wanted to be far from this town. And also she wanted proximity to Nairobi to seek medical attention. So I'm sure there is some documentation about the sick of and our whereabouts currently. I'm sure.
Daktari,
Yeah.
why is it that until I raise that issue, is when now you, as a department, wrote a letter indicating that she has health issues, but you've confirmed here again that you released her on social issues. Social issues means it could be a lifestyle issue that has affected our service delivery.
Yeah,
now,
it was going to
for,
affect.
For 8 months, 9 months down the line, she's not on duty. There was no replacement. My people are suffering. The department, the pharmacy there now, at night, they're not dispensing drugs at night because there's nobody. Those who are there few, they're working during the day.
So I want the details to be given by the CEO, because when I was on what's it called, on Kokwe last week, I saw her as the county pharmacy, although we never talked. So more information I think should come from.
So, Dr. Sirma,
yes,
you said you released her on medical grounds. So how did you find her in Olkokwe?
It's last week.
Dr. let's be sincere.
Yes.
You know, I'm elected to represent my people.
Yes.
And that is where now we'll get issues with you. My people are not getting services. They are not getting drugs at night. Just because you did your local arrangement and released this lady. It's only until yesterday when you knew that we were on this case that you tried to act. Why are we doing this, Madam Lance?
Madam CEO.
Thank you, Honorable Member, through the chair. It is true that at some point, I think, not even yesterday, I think you called way back, you informed them about the same. But before then, we had the information, and to be sincere, I had called the med sup there to give us a report about the lady. It took some time before writing the report, until I think until beginning of mid 5th May, around May, then he responded. But then through our phone call, he tells me that he is unable because, you know, the lady has a lot of issues, social issues. Yani sometimes she anasema sijui kuna watu wanamfuata. She has some psychological problem and she's undergoing treatment, and like kind of like he had some human heart. Maybe he said over the phone. But then I said, please document and send. Now we have the documentation plus supporting documents from our doctors.
Okay, so you confirm that whatever I'm saying is true?
Yeah, you called.
Then the one that Dr. Sirma met in...
she has resumed work, I'm sorry. Let me finish. She has resumed, I think like 2 weeks ago.
So she's on duty.
She's
When I
on
go to
duty now.
Mogoti, I'll find her.
2 weeks.
Madam, when I go to Mogoti, I'll find her.
I assume so because that is the report from the MedSup. That 2
Because
weeks.
if that is my situation, if I appear in Mogotio and she's not on duty, then I suspect now you'll carry the burden. You'll be held responsible for that.
That's okay.
Okay. Now there's The other issue I've just raised, you can answer that as I check what my colleague is trying to communicate.
Proceed.
Which one was that? I talk when he wants the answer. I continue.
Wait.
Okay.
Madam Chair, I've just received an information that, and I told you, Sirma, when we ask these things, we're asking out of information. The information reaching us is that the reason why that lady was transferred to Mogotio was because of a fraud that happened in BCRH. The BCRH lost 34 million. And instead of dismissing her or even subjecting her to disciplinary processes, you decided to transfer the problem to me in Mogotio. Transfer the problem to the people of Mogotio. Madam, you guys, are you really fair?
Thank you,
Just before you
member.
respond.
Okay.
Yes. And an additional information reaching us also is that this particular lady is a wife to one of the senior persons working in the office of the governor. So the department decided just to cover up by sending this lady to Mogotio. Now, what happened and where the money that was stolen? Did you recover the 34 million before sending her to Mogotio to bring problems there?
Okay, I do not have a good answer for that. Maybe the director could have a better answer for that one.
Yeah, we
but
want
allow
to,
me to just answer the first one that you talked about, why we release, why it's like we are giving more favor to the medical officers to go to school and the junior staff. We don't seem to favor them. I want to answer that one. And then for the case of Pauline, I will allow a director to answer because he's been there longer than I, and I found her already not in BCRH. So for the medical officers and the junior staff, I want to confirm that we as much as we're talking about giving permission to doctors, I want to say that, you know, when we are approving someone to go to school, it is only allowed that if you are doing something above, like master's degree, you know, the government can sponsor you in form of time and even sometimes money. But when you are doing a basic degree, then the government, they used to do that until, I don't know, some point. I cannot say until when, but the policy changed. And then now, if you are going for a basic degree, the government cannot sponsor you for that. Unless you take maybe an unpaid leave, then you go to school. But however, I am aware of some nurses who have been released to go to school for higher diplomas and diplomas.
Madam CEO, before you proceed to give the mic to donate your time to Kangor, I would like to know if you know about the fraud. Because you seem to be honest, your answers have been very straight and genuine. I want to know about if you know that fraud of the state pharmacist.
By the way, I've never heard. Sijaisikia.
Okay.
Nasikilia hapa.
Kangor, proceed.
Through Honorable Madam Chair, personally, I'm not aware about the 34 million fraud. Maybe we'll find out. That is being honest. In terms of Pauline being available, last week we were able to visit Mogotio, and she was actually with us in Olkokwe because I was with Waziri. And I believe she's back.
Honorable Sialo, on that matter?
I think Madam Chief Officer has accepted to bear responsibility. And I guess also Dr. Kangor is following suit. If we find that that lady has not reported, the two of you will be held responsible. True. I think that one we are in agreement. Number two, on the issue of the scandal, you two are not honest. We have we have memorandums, we have formal communications to us on that particular issue. That's why it has been raised. So I'm asking you again, are you going to bear responsibility of this fraud that you've failed or refused to disclose? To disclose. I want you to be on record, Daktari.
Yeah, honestly, through my Madam Chair, I'm not aware.
I can see Waziri want to say something about that issue.
The fraud, I have not heard about it. I think because you talked of BCRH, I think Dr. Bakalo will be in a position to confirm to us whether there was fraud.
Dr. Bakalwa, are you aware?
Honestly, if there was any fraud of even 1 million or 2 million, I would be aware. 34 million? I don't know that.
Let's leave alone with the figures. Is there a fraud?
None that I know of.
I want to be on record.
Yes.
And you're the medsup.
Yeah.
What was the reason of transferring that lady to Mogoti? Can you be honest and sincere? Because now we are going to a different dimension.
Okay. I can only account for her transfer from BCRH. She was transferred from BCRH to the county health management team. And
when was that transfer?
I think 2022, 2023, thereabouts. And when she became the county pharmacist, then now that is beyond me because she was in the county health management.
Okay,
I can see Madam CEO as a concern.
It is a request. We had requested earlier to be, wacha nisifika hapo, nilitaka kuombea ruhusa Bakalwa and the admin. They are supposed to be in Nakuru. They were supposed to meet the auditor general in Nakuru by midday today. We are supposed to appear in Nairobi on Wednesday, and they had made an appointment with them. I wanted to request, if it is okay with you, we will try, if there's any question before they leave, if you allow them to leave, then we will appreciate so that they will be able to meet.
Dr. Bakalo and admin, proceed.
Madam
At
Chair.
least you appeared last week.
I seek your indulgence.
Okay. Any question to Dr. Bakalo and admin?
I want them to confirm something. That before the lady was released, or really even after the lady was released, was there an internal audit, forensic audit that happened in the department?
Dr. Bakalo.
That is released from our hospital.
Yes.
You know, when she left our hospital, she was appointed as the county pharmacist. And for us, audits happen in BCRH every time. So I may not know if there was one that is attached to anything. In fact, we are audited average more than 6 times a year. So
we asked you about this thing. Yeah. The chair was even fair and said, let's leave about even the figure that got lost.
Yes.
Any fraud that happened, all of you have denied. Now we've gone deeper into the thing now. I'm asking you, was there forensic audit that happened?
Audits do happen. I'm not sure which one.
No, you cannot be. Dr. Be honest.
However,
don't tell us you're not sure. You are the medsup. Every time an auditor, either internal auditor or external auditor, comes to your facility, you must be informed. And the entry point, for that matter, is your office.
Yes.
So you cannot tell us you don't know.
But I can't say I know what I don't know.
Okay.
What I know is the only time that we had what I can say a theft, it occurred about some commodities. And this I reported to the DCI. They did their investigation. I could not hide that one.
What was the cost of the commodities that got lost?
I do not know, because those who did the investigation.
I'm saying the value.
I will need to confirm that.
Daktari.
But
if it is a you reported. So what did you report? That which commodity had gotten lost, and what is the value of that commodity?
I reported that there are some commodities which the in charge of a section said he received, and there is a discrepancy in what was actually recorded as received.
So,
And
can you
so-
declare what were these commodities that got lost?
They were, I think they were test kits, HIV test kits. And that one, I found myself to be not qualified enough to do an internal investigation. I had to involve those who are better qualified. That's why I reported to the DCI.
Okay, maybe, Madam Chair, as you release them. So, you've heard of the audit that has been done. So, if we provide this list, I mean the audit, and the findings of the audit, are you going again accept to bear responsibility?
I think Honorable Sialo, let me help you so that it looks fair enough as the chair. Daktari, you earlier you had alluded that you are not aware of any fraud. Now, the fraud that Honorable Sialo is talking about is about the lady, the pharmacist, who was there. Now at least you say there was a fraud and you reported. If we go finding with our own fact finding,
yes,
and find out that the said lady was involved, are you ready to bear the consequences?
My responsibility there was very clear. When I noticed that we had this theft, I reported to the DCI. The DCI have not given me any report subsequent.
There's no problem, Daktari. The only thing Honorable Sialo is asking is we are going to do a fact finding about this issue. And definitely all of you knows. You're just trying to cover it up. And was it lynching the department of that lady?
Honestly, I have absolutely no name attached to that.
Thank you, Honorable Sialo.
It's good they've confirmed that there was theft. But I want to ask, you reported, right? So you expect the DCI to take action on their part. Now, on your part, as a MedSup and the HODs who are here, what actions did you take against that person or those two people who are handling those equipments and those drugs? As you wait for the action from the DCIO, what actions have you taken yourself? Do you still have that person? Or you went ahead and transferred the problem to Mogotio?
You see, I've said this and I want to say again. When I reported to the DCI, I did not have any name that I could directly link to that theft. So I expected the DCI to give me a report. Then I can know so and so is
Madam Chair, I think Wabakolo is trying to take us in circles. Can you be honest, or we just chase you now?
I will accept to be chased
Because
I'm being honest.
how do you report? Now, which department was it responsible?
Pharmacy, procurement.
So that pharmacy does not have a person who is in charge?
Yes, we have an in charge, we have procurement, we have stores, and they were all investigated.
If that person was in charge, instead of you reporting that person or even dismissing or putting her through the disciplinary action, you decided to transfer that person to Mogotio to come and again bring problems there.
When I reported to the DCI, I had to get a report from the in charge reporting that we have a theft. That is what I used. So when I inquired what is happening and I did not get a name, I used that letter plus my covering letter to report to the DCI.
Did you report to the department?
Yes, in fact, even our CEC told me, such a matter, please take it with the police.
What was the kind of report you made? Was it a formal?
Yes.
Was it written?
It was written. I even have a copy of the DCI receiving my report.
Madam Chair, I think we need a copy of that letter. That was written to the department first of all, and then the one you made to...
No, I did not write to the department. I wrote to the DCI, in
DCI,
consultation with the CEC.
Now, are you reporting to DCI or reporting to the chief officer?
Well, you know, this is a matter...
Because you cannot just go directly without the involvement of the chief officer.
Maybe there was a lapse there. However, the best I could do is to arrest or to find out the root cause through investigative organs, which I did.
Dr. Let me ask you something. If something got lost in your office, a valuable commodity for the government in your office, who is going to be held responsible?
the medical superintendent.
Yes. So in this case, this lady is in charge.
Yeah.
Some drugs got lost, but instead of even holding her in that capacity for investigation to go on, you just decided to transfer that person.
By the way, the in charge of pharmacy that time in our hospital was Dr. Chebon. And the letter that I used to go to DCI was signed by Dr. Chebon, if I'm not wrong. But I'll bring it. I'll produce it, and we can even go get a copy from DCI.
Who is Dr. Chebon?
He left the country, and he is away for study, and I think he left the country for studies.
And who is Chebon in the governor's office?
No, I'm talking about Dr. Joseph Chebon.
Oh, this is another Chebon.
Yes. Yes.
Chebon.
Yes.
Okay, okay. Now, what informed the transfer of this lady when an investigation is still ongoing?
From BCRH to become a county pharmacist, surely that is the decision of the county.
Not you.
Not me.
Madam Chair.
Yeah, because
I can
now
see
she became
admin.
my boss.
I can see admin want to say something to save the MedSup.
There was the question that if something happens in the hospital, as it is reported to our bosses, we work very closely with the national government, the police, the DCI, on many things as an hospital. So it is not really honorable. Sometimes the MedSup can communicate directly to the DCI or to the police. There are so many other things. Like sometimes a patient can run away because of maybe the person is mentally not correct. We report to the police. There are so many things that we work with them. Sometimes it gets to our bosses. Sometimes the MedSup does it. So by approaching the DCI on that incident, Honorable, may not necessarily have been that he usurped the powers that be. So that is a clarification which I wanted to make. And many times, there are things that we do with them very closely. And when some patient runs away, we inform them, then we help each other to bring that patient back. And
Now that admin you're here, are you aware of the fraud?
I'm not aware. I'm not aware. No, I'm not supporting Mheshimiwa. I'm just clarifying something on the issues that maybe the MedSup approached the DCI. There was one casual who was involved in fraud. We got the casual. We dismissed the casual. We reported to the DCI, and the case is ongoing. So that is a different issue altogether. So it has nothing to do with the one that you are alluding to.
Honorable Sialo.
Thank you. I think, admin, you've confirmed that it was right for Dr. Bakalo to report, even if it was not through the department. So what do you think he was reporting if you are not aware?
Be on record.
If there was a fraud and he reported it, indeed he shared with me about that, although I was not in the hospital. I was not in the hospital.
So, Madam Chair, I think, thank you. You've
but
confirmed.
the way he mentioned it, it's exactly what happened.
Okay, thank you, admin. I think you had misled this house, but again, you've confirmed that he told you that there was a. And then why were you denying? Okay. I think that one we are in agreement. Madam CEO and your colleagues.
Before you clear, I don't know now if the MedSup left to where he was supposed to go, or he's still supposed to come back. Be on record.
Madam Chair, he's still coming back.
Okay, noted. Honorable Sialo.
Thank you, Madam Chair. I wanted to inquire from Madam Chief Officer and his counterpart if that issue was brought to your attention, and if it was reported to you, what were these commodities that got lost? How many drugs, which kind of drugs, which items were reported to you that they are missing in the pharmacy?
Through the chair, I am sure this incident happened before I was posted.
Our CEO, Ruto, you were there. Take up the matter.
Thank you, Honorable Chair. I think that issue falls under Medical Services Department.
But you can't tell me, CEO, when such a fraud happened, even in your office, you've never heard about the fraud. You may not have the details, but did you get to know about the fraud?
No, Madam Chair, no. I did not
was
about
it?
the fraud.
About the casual, that one he told me verbally. Not the Dr. Pauline, but for the casual. He told me there were non-pharmaceuticals, and he had already reported to DCI.
They are failing to disclose the items that were stolen and the drugs that were stolen. And I think that is the information that is in the report with the DCI. So I didn't know why the guy didn't want to disclose the other drugs that got lost. And at that particular time, we've confirmed the person who was there was the lady that he transferred to Muguti. And the only disciplinary action, I don't know if it transfers a disciplinary action or something. The only thing you've done is only to transfer to Muguti because there was a fraud at the pharmacy where he was heading. So was it right for you to transfer this person to Muguti when he has committed the offense?
Dr. Bakado?
Firstly, I do not confirm that I transferred this officer. This officer that you are talking about was working in our hospital and was appointed as a county, or maybe she was county, the pharmacist. But the person who was in charge of hospital pharmacy brought me the report, and I used that report to have the matter handled. So at that time, we have documents to indicate what was stolen, indeed, what was missing. But I say, to quantify, I'll have to confirm, because I have documents to that effect. That's all, Madam Chair.
Daktari, before the lead was transferred to the department level, was that incident after or before she was transferred?
It may not be very clear to me, Madam Chair Lady, because even when she was in pharmacy, most of the time her office was at the hospital. And even the current county pharmacist usually sits at an office in the hospital.
When was she transferred to the department? Which date?
I may need to confirm. Yeah.
Okay, when did you report that the hospital lost items?
I will need to confirm because I have those documents. If I'm given time, I can produce those. I can produce the date, when it was reported, when they were delivered, what were the quantities that were delivered.
I think
That
because you refused to disclose, let us find it out. You just table the documents, the report that you reported, any formal complaint that you passed through the department, the chief officer's office, and we'll find out the rest. Thank you, Madam Chair.
I think we allow Dr. Abakalu and the admin to leave so that the CEO said they will take charge of any question that is going to affect them. And Dr. Abakalu, kindly get us the documents. I don't know when now that you're busy.
The soonest I can do that is next week. That will be Monday.
Next week when?
Monday or Tuesday.
Let me give you Tuesday at 10 a.m.
That's fine.
Thank you.
Thank you.
Honorable Sharon, kindly we wind up so that we...
Yeah, owing to the time that we have, I'll be very straightforward in my questions, and if I ask a question, please, let's just be direct. And I'll proceed to ask the CCM, you can put your mic on the issue of transfers. What really guides the transfers? We know that the county public service board, they usually do certain level of transfers, and there are ones that you do as a department. What really guides you? Do you have a policy, or you just a guideline, or you just wake up and do things as you want?
We do within the department, but interdepartmental is done by the county secretary.
And actually put your mic very close because we are really losing you.
I'm saying
yes.
Within the department is done by the chief officer, the two chief officers, the director, and heads of programs.
Okay, do you have a policy?
Person who is interested.
No, we don't.
No, we don't have a policy.
Do you have a? Okay.
Yes.
Don't you think that there is a risk of having a politically motivated transfer, or when you get irritated with someone, can just wake up and make arbitrary transfers? And in that regard, I've done my research. There are other counties that they do have policies that guides transfers. You can check as the head of that department, Kisumu, they do have one. Muranga, they have one. You can actually check, and probably you can start working on a policy on transfers. Another issue is on that one for Florence. Waziri.
Yes.
We understand that the Department of TB, they get a lot of funding. Do they?
Although now it's going to reduce because
okay,
of
but
the stop
in
work.
the past they used to get a lot of funding.
Yeah.
Okay, so even when you're adding someone another role, you've said that it's actually not like you're transferring this person, you're adding this person additional role.
A responsibility.
A responsibility. You're also giving this person a mandate. You're making her you're giving her some level of control because she's going to control her department with a budget, right? Right?
In terms of, the kind of money that she gets is for supervision.
Yes.
Mostly, yes.
And then there's an additional money that's going to get.
Yeah.
Okay. I really want to see by close of business, I still want to see the procedure that you used to actually give that lady that particular job. Waziri,
yes.
On the issue of level 5, what was the intention of whoever? Is it you, the governor, or yourself, of calling our hospital level 5 when it was level 4? What is the intention?
It's not me.
It's who?
Yes.
It's who?
It's in the website.
Who?
But it's not me.
Okay, who controls the website? Is it done by somebody who is outside the hospital or someone who works within the hospital? Is it a property of the hospital?
It's the communication team from the governor's office.
Is the website a property of the hospital or is it?
It's for the county.
Website?
Yes.
Who procures the website?
I know it's the county website. It's a county website.
At this point in time, I wanted Evans to actually answer this but you can go back. Let me go. Nancy, who procures? Is the website a property of the hospital or is it the executive? And remember, this is something for our website to be developed. There's a budget that is put and it's paid.
I think, Honorable Sharon, I want Honorable Locales to be clear on that issue of where the posting was done. Is it at the health?
I have checked.
It's on which?
It's actually, I've seen. It's the hospital's website. And I'm even seeing the CEC there taking oath. I've seen his photo and the rest of the CEOs. And saying what
proceed, Honorable Sharon.
So I'm asking, is the website the property of the hospital? And you know, if you don't have an answer to that, you are responsible. You are the CEC. You are the CEO. You are an accounting officer. That money is paid yearly. There is a subscription that is paid by taxpayers' money. So you should not say that you don't know. Ignorance at this point cannot be a defense.
I am aware of the website.
Yes.
Not that I'm ignorant.
Yeah.
I am aware of the website.
Yes.
But the subscriptions, I have not paid.
You've not paid?
Yes.
It's paid. When did you come to the office?
6 months ago, December.
Or probably it has not expired, but usually it's something that it's paid yearly. So, at this point in time, I'm wondering what was the intention really? Like, it's something that really puzzles me. Because according to the law, misrepresentation. Let me read to you, Daktari. The Social Health Insurance General Regulations 2023 explicitly states that misrepresentation or providing false, incomplete, or misleading information may constitute medical fraud and attract legal penalties. At this point in time, who do you want who is the person who should be liable of misrepresenting to the whole world that Baringo County Referral Hospital is a level 4, level 5 hospital? Okay, just put on your mic, please.
It's domiciled at the communication office of the governor for all the information.
Are you
even for speeches of the governor?
We have the executive, we have a website that belongs to Baringo County government.
Yes.
That is where we get all the details of the governor, his speeches and everything.
Yeah.
And then we have this particular one that really talks and shows the mission, the values, the mandate of the hospital. So there are two different websites.
Is it the hospital or the county department?
Is the hospital, the department of your department. Your department.
No, there is a difference between the hospital and the Department of Health.
On Dr. Sinma, do you want me to show you the website? And at this point, you want to say you are a CEC of that department, you're not aware of the website?
You see, if it was, you know, I don't look at the budget all the time of the hospital, but I know the budget of the department. And I've not seen anywhere where we pay for that website.
Okay, so at the end of the day, somebody should, I've seen it's the county government of Baringo, the county of great diversity, health services. That is where they are saying that the Department of Health, whatever, and saying that BCRH is, that one I need to withdraw and apologize. The person to be blamed for this mistake is the governor of Baringo County and the Office of Communication. So because, Chair, such level of misrepresentation, you know, by the time they're saying that this is a level 5 hospital, it means that we have this, we provide these services, we have expertise on this and this. So somebody can actually come to a hospital thinking that they can get this service, yet it's not the case. So we are misrepresenting to the public. So that is something that we need to take note, Chair, that we are lying to the public. The governors, the executive is lying to the public about the status of our, we call it referral hospital, after, maybe it's not a referral hospital anymore.
Honorable Sharon, we've noted your concerns. Waziri and your two CEOs, you and Kangor, thank you for coming. And there are so many issues that we've noted. We will still do follow-up. The whole county is watching, and all of us has to go back and at least do things right. What we pointed out here should be taken seriously, and in our next station, we should not ask about them. Thank you so much. Sergeant Atam, walk them out. Dr. Ruto, I've made a ruling. Members, let's break out for lunch and then we come back in 30 minutes. Yeah, for the live coverage of our CS. Thank you. And the Chief of Staff. Thank you.